welcome everybody. We're just waiting for some more people to join and then we'll start. Thank you for joining. joining. My able co-host, Rumi, you can stop the music now, please. Thank you very much. Good afternoon, everyone, and thank you for joining the On Your Health July 2021 edition. The topic, the misuse and abuse of medicines and illegal substances. So my name is Flora Coker. I'm the founder of Encapsulate Healthcare Solutions, who's bringing you this program On Your Health. On Your Health is a public health awareness program for all Africans. We aim to give you information that will inform you, educate you, and help you make better choices regarding health, and also not just to help yourself, but help those around you, so that we are all making better choices. There's a lot of misinformation out there, and we want to ensure that we are giving and you are receiving the right information. So it's almost, it's 11 minutes past 4. I'm just going to go straight to it, and I'm going to introduce our first speaker of the day. Her name is Marilyn. She's a chief pharmacist and has been qualified for about 20 years. She's a specialist substance misuse pharmacist and also an independent prescriber. Marilyn is the professional lead for medicines management within the organization that she works for. She's the medicine safety officer, home office responsible person, and controlled drugs accountable officer. Her full name is Marilyn Nathan Wilson, and I will hand over to her now.
Thank you.
Marilyn, over to you.
Thank you so much, Laura. Thank you so much for having me, everyone. I'm just gonna share my screen. Okay. And excellent. Can everyone see this? Thank you.
Yep.
Okay, thank you so much. What Flora forgot to add is actually Flora is one of the key people who actually should I say, guided me or pushed me to become an independent prescriber. So she was actually, can you hear me? Yeah, she was actually one of the, should I say, destiny helpers to helping me formulate my career, even in addiction. So thank you, Flora, and thank you for this opportunity as well. Okay, today I'm going to talk about drug misuse, drug abuse, and addiction. What's the difference? Because all these terms are actually used interchangeably. Okay, so I'm going to take you through that. Next screen. First, I'm going to talk about what a drug is, just going to touch a bit lightly on that. Then the purpose of medicines, the definition of drug misuse, why medicines are misused, and the examples of the type of medicines which are misused, drug abuse in itself and the causes of drug abuse, drug addiction, going to give you the definition of that as well, dopamine and its role in drug addiction, pharmacotherapy, and hopefully if you have any questions, I'll try and answer them to the best of my ability. Flora, do they ask questions at the end or they can ask them in between? What do you prefer?
At the end of your presentation.
Okay, thank you.
Yeah, I just forgot to say, if you have questions for the speaker, just pop it in the chat. Thank you.
Excellent. Okay. Okay, that's perfect. Okay, so what's a drug or medicine? Just trying to move the screen. It's got the little, excellent. That's it. I'm moving. I can see myself and others, but I'm trying to move it. Okay. What's a drug? Perfect. What's a drug or medicine? Now, a medicine, as we all know, is trying to see all of us as well. So I'm trying to move this, but it's misbehaving a bit. Okay, don't worry about it. I'm sure.
You might not see everyone, but some people.
Okay, I can see. I noticed that, and I'm trying to move it a bit, but it's doing this timer thing. But it's okay. That's fine. But I can't see myself, so I don't know how I'm presenting. But it's fine. Just let me know. Oh, it's not responding anymore. Flora, can you see me? Oh.
Yes, we can. Just give it a minute to recover itself. While that's recovering, just a reminder that if you have any questions, just pop it in the chat. Welcome to everyone who's just joining us. Marilyn is our first speaker. The internet is trying to receive sense right now, so we're waiting for it to receive sense before we carry on.
I've got it there.
Fantastic.
So, first of all, a drug, a medicine. What's a medicine? We all know a medicine as a substance which is actually used for treating a disease. However, the definition of a drug is a compound, or should I say a chemical that's been synthesized in a laboratory that is actually meant to gotten from maybe origin or marine origin to bring about change to normal physiological actions. So can I just note right through this talk, just remember all medicines are drugs, but not all drugs are medicines. Okay, I'll explain a bit further. Now, the purpose of medicines, as I mentioned before, medicines are meant to treat. For example, they're meant to cure, they're meant to control, they're meant to prevent the disease, they're meant to ease symptoms of a disease, and they're also meant to diagnose a disease. I'll give an example. You have a cough. You go into your GP surgery and you explain to him, I have a bit of a chest infection. I think it's a chest infection. He examines you and he prescribes you antibiotics. If you take it the way it's supposed to be for that particular infection and that type of frequency, it gets treated. So that's the cure bit. Another example, somebody goes into their GP surgery for blood pressure. They've got a high blood pressure. What does the GP do? They'll prescribe antihypertensives. Now, that's not supposed to treat, but that's supposed to control the condition to ensure that the high blood pressure doesn't affect your organs. So that's an example of medicines controlling a condition. And another example is prevention. We all know about vitamins and we take vitamins. I'll give you an example, vitamin D. We've been told to take vitamin D countless times. And that's also to prevent a condition, for example, called osteoporosis. As we get older, our bones get a little bit brittle. Vitamin D with calcium helps, shall I say, strengthen our bones. So we take vitamin D to ensure that our bones are not brittle and they don't break. That's an example of prevention. Another example is vaccines. I'm going to be very careful because I don't know how sensitive people are about COVID vaccinations. However, I'll still use that example. Vaccines are used to prevent. So you take a vaccine or you'll administer a vaccine to ensure you prevent the occurrence of the disease. What happens is you get the vaccine creates antibodies. Those antibodies are there just in case the virus affects you. It doesn't affect you as much. So you're able to fight the infection. So that's another way of preventing an infection. Another one is easing of symptoms. We get given codeine for pain.
Let's see what happens. She'll try and connect back. I think our internet is playing. While we're waiting, can you let us know in the chat where you're joining us from? Once again, thank you for joining. Let us know where you're joining us from and say hello. I can see some people I know. Okay, we have Princess from Lagos.
Princess, yep.
Hi, Tutu. She's joining from Edmonton in North London. I know where you are. Who else? Where are you joining us from? I can see some people that I know, some I don't. I don't want to call out the ones I know. Let's say hello to the ones that are new to us.
Mr. Jai as well from Lagos, welcome.
Oh, you're welcome from Lagos. Thank you for joining.
Ibadan.
Wow, Ibadan. I hope Ibadan did not flood yesterday. Okay, Marilyn is back. Oh, we have someone else from Lagos. How are you people in Lagos coping with the floods yesterday?
Got somebody from
Greenwich. It's not raining
well
today. So I'll just make Marilyn a co-host and then we can get her to continue presenting. Just give me 1 second. All right, hi Marilyn. Tell your internet to behave itself.
Can you imagine? And I was on a roll. I couldn't forget my stuff. Sorry, guys. Sorry.
All right, so share the screen again. You should be able to share now.
Fabulous. Don't worry, guys. I'm not going to go through everything I've said, but
okay. So start from the one you were on. Yes, I think it was like
fabulous.
Yeah, there you go.
Fabulous. Right, I'm going to just take you back. I won't go back because I'm very conscious about this, but just wanted to go back to if you have a back pain. So you have back pain, you're given codeine, you're given paracetamol to treat the symptoms. It might not treat the pathology, but it will treat the symptoms and ease the symptoms. The last example is medicines are used to diagnose. So you're given things like atropine drops to put in your eyes when you go to the ophthalmologist. And what's that for? It's to help your pupils dilate so that they can see better. Another use for atropine is actually used to treat lazy eyes as well. So all the 5 examples I've given you are for you to understand medicines have a purpose. Okay, right. Now, bear with me. Now, talking about drug misuse, abuse, and addiction. They're all serious public health challenges, each to their own. And the reason why they're challenges is with drug misuse and abuse and addiction, it's to deal with the use of illegal drugs and also the inappropriate use of legal drugs, tobacco, alcohol, or prescription medicines. So we need to make sure we define exactly what the person's problem is, okay? Because some people are only misusing the drugs. They're not abusing them. And some people are addicted to them. So we've got to make sure we can define and make a distinction, okay? Okay, now, drug misuse. I'm going to give you the definition for the World Health Organization. That's WHO, WHO. And they define it as the use of a substance not consistent with the legal or medical guidelines. By that, they mean the doctors told you to take antibiotics for 7 days, frequency 4 times a day, and you will go and decide and diagnose your own self and take it for 3 days because you feel better. That's misuse. Now, you're not trying to misuse it because, oh, I just want to misuse the drug. You just feel better and you think, why should I take the rest? I don't need to waste these. I can put it aside and use them for another, if I get another infection or so. So that's an example of misuse, when you're not using it consistently with the legal or the medical guidelines. Another definition is Department of Health in the UK. This is 2006. And it's saying that drug misuse has a negative impact on health or functioning, and it can actually take up the form of drug dependence if one doesn't take care. But when I take you through, you'll understand what I mean by that, how drug misuse can actually graduate to drug abuse, which can then graduate to drug addiction. Okay, do let me know if I'm speeding through, because I think I'm a little bit anxious about the thing going funny. So I'm trying to get you through this. Okay.
You're fine.
Now, why are medicines misused? Why on earth do we even take it upon ourselves to misuse medicines? I'm just going to move this to the side so I can see the whole thing. Okay, why do we do this? The reason why we do this is it's not we sit down and think, like I said before, we want to misuse medicines. A doctor might give you medication like, for example, take 400 milligrams ibuprofen. You think, no, I think I'll take 600 because the doctor doesn't understand my pain. That's the inappropriate medical use as well, when you take too high the dose of the dose. Another inappropriate medical use is you've been given the tablets and you've been told, just take it for 3 days. No, the pain is continuing and you decide, you know what? I want to take it for 7 days because I can't deal with the pain. What you're doing, you're not helping yourself, because it could be actually an underlying sinister condition that the doctors thought maybe this is just a 3 days thing. You've taken it for 7 and you continue to mask the symptoms of something that's underlying. So that's an example of inappropriate as well, when you take too high or you take too long. Another example is medication dependence. You've been given codeine, you take the codeine and it's meant to be for, I don't know, spinal injury, right? But then the thing is, when you stop taking it, because codeine has this really nice euphoric effect and it makes you feel really good, you kind of like get withdrawal symptoms when you stop taking codeine. So that's another example where you've become a little bit dependent on it, not because you want to, but it's because you just become used to the feeling, the good feeling it gives you. Another example, which many people, some people I know have had to go through, is attempt to change your body shape. Some people might want to lose weight. And what they'll do is, rather than take the long way, because, oh my gosh, I've tried several times myself. It takes me, I lose the weight, then I put it on so quickly. Some people may revert to laxatives. And the reason why they do this is they might take things like Senocot, they might take things like Dulcolax. And what they do is, yes, they give you the diarrhea, you feel you're losing weight, but it's only temporary. But the consequence of that is you end up having a lazy gut, because now your gastrointestinal tract, has gotten used to having Senocot or a laxative to go. So then you lose your type of ability to defecate. So that's also another way of misusing medicines. Another example is the unintentional use. Somebody will go to the pharmacy and they get told, oh, they think, or they've been told by a school mother will go to a pharmacy and say, I heard there's some head lice in my child's school. Can I have some head lice treatment? And they get given the head lice shampoo. But that's actually not the right use for the shampoo. The use of the shampoo is for when the child has head lice. But the mother will think, I'm trying to help my child. So even though the child doesn't have the head lice, they'll go and use this shampoo, thinking they're preventing it, but it's not treating anything. Now, the last two are what are going to lead me to the drug abuse. Here, you're deliberately abusing for non-medical reasons. Decongestants. Decongestants make us feel a little bit high. They give us a stimulant effect. So we buy them over the counter. So some people would buy them over the counter because they give similar effects to illicit street drugs. So you go, you buy a decongestant to give you that little bit of a high. That's deliberate misuse. And that's why I put abuse there. Take note. Another one is to facilitate the use of illegal substances. People get cocaine, they buy this from their dealer, and they need ascorbic acid or citric acid to mix with the cocaine to make it soluble enough for them to inject. So here, somebody's actually buying normal substance to mix with cocaine in order to elicit a much higher high because it's going through by being injected. So these are a few examples of how drugs can be misused. Now, another example, just a few, just to summarize this section, is taking the incorrect dose. I've already mentioned that. Taking the drug at the wrong time. You're given antibiotics, you've been told, take it 4 times a day. You decide it doesn't fit your schedule and you decide to take it twice a day. Now, the reason why you're told to take it 4 times a day is because when you take medicines, you need the medicines to remain on a plateau level in your bloodstream to be effective. So the reason why you may be told to be taking it 4 times a day, which is every 6 hours, is because we're trying to maintain constant levels of that drug in your bloodstream. Now, if you take it 4 times a day, twice a day, what you're doing is you're not maintaining those blood levels. So it's dipping. And when it dips after the 6 hours, it's waiting for the drug after 6 hours. And you've chosen, I'm going to take it twice a day. That means the drug becomes ineffective, sorry. The next one is forgetting to take a dose. That's another way of misuse. Somebody's been given the contraceptive pill and they're meant to take it daily in the morning, for example. This is I think it's the progesterone you're meant to take a certain time. Anyway, the mini pill. And if they forget to take a dose, that's another way of misusing because you're not following the manufacturer's guidelines. Another one is, I've already mentioned that, stopping the use of the drug. The next one is taking the drugs for a reason that they were not prescribed for. So I'll give you an example, and some people tend to do this at home. You see a bit of a diclofenac gel in the medicines cabinet, and you have a bit of a pain. And you're thinking, well, I used it for that the other time, I could use it for that. No, if it's not meant to be treated for that condition, don't misuse it for that. Another one is taking something that's not prescribed for you. So your mom has a certain condition, you think, oh, it's similar to mine. It's not been prescribed for you. Your mom has a different medical condition, different medication history, and yet you've diagnosed that suits you. That's also another example of drug misuse. Now, I'm just going to give you a few examples of misused antibiotics because just to familiarize you with them, okay? Amoxicillin. When I remember when I was back home, this was ages ago, you'd have an amoxicillin capsule, okay? And it's like yellow and, as I remember, yellow and purple, pink, yellow and dark pink, okay? Anyway, and instead of somebody taking the tablet to swallow, sometimes people would open it and sprinkle it on the sore, this open wound or something, thinking that's how it's going to work. No, it's actually put in a capsule for a reason, so that when you take it in your gastrointestinal tract, in your stomach, it actually follows the right trajectory to treat you. So putting it and sprinkling it on your sore isn't going to make it effective. That's another example of misuse. Another one is Flagyl, which is metronidazole, and other antibiotics. People tend to buy them over the counter in different countries. And by doing that, what you're doing is you're creating antibiotic resistance. You might think, I'm nipping it in the bud. If I take these antibiotics quickly, they'll help. You're probably not even treating the right type of infection. So you're actually buying an antibiotic for the wrong infection. And once again, what are you doing? You're creating antibiotic resistance. So when you really need that antibiotic, it's not effective to you anymore because you've overused it for something else. I've already mentioned the fact that we can abuse paracetamol, ibuprofen, and even aspirin. Now, we've got to be really careful. For example, ibuprofen. Ibuprofen is a non-steroidal anti-inflammatory drug. And one of the side effects is it can actually affect the lining of your GI tract. So some people might take it without food. That's another way of misusing it, because what happens is when you don't take it without food and food is not lining your tummy, what happens with that is some people actually get ulcers. And you don't want an ulcer. That's the most painful thing I've heard from some of my patients. So that's an example of misusing when you're not following instructions, as in you're taking a higher dose or you're taking it without food. So sometimes simple instructions are given for a reason, to protect you. So ibuprofen, take with food. Paracetamol even. Some people would think, well, what paracetamol is harmless? I don't have to take 2, I can take 4. No. Taking too much paracetamol can actually have an effect on your liver in the long term, not immediately, but in the long term. So please, let's take those medicines carefully. Just because they're available over the counter doesn't make them safe. There's another example I'm going to give you as well. And many people are guilty of this. I don't know about others. Vitamins. Just because something is a vitamin or just because it's a supplement doesn't make it safe either. Now, vitamin C, they'll say 1,000 milligrams. Some people think, well, let me just take 2,000, at least it'll nip things in the bud and get things working quickly. No, it's 1,000 milligrams, and 1,000 milligrams is the limit. If you take 2,000, it's still not going to make a super effect, because the receptors that vitamin C are working on are overloaded anyway. So it's not going to make an effect, and so you're going to actually create diarrhea. So try and let's avoid and make sure we stick to a dose for even a vitamin. Another example that I get concerned about is vitamin A. Now, vitamin A is a fat-soluble vitamin. If you now take too much of that, you're actually creating damage to your liver, because what happens is it builds up in your liver because it's fat-soluble. So unlike vitamin C, which is water-soluble, which gets excreted, so then you get your diarrhea and it's gone, vitamin A will build up slowly in your body. And because it's fat-soluble, it's storing up in your fat tissues. You don't want to do that. Please just stick to the dose for your own safety. Okay. Now, this is something that I'm going to keep harping on about. Cold remedies and also Phenergan. I don't know if I'm using the right name for Phenergan, but Phenergan is like a sleep aid and it's an antihistamine. You're supposed to be taking Phenergan at night, one at night. So you take it at 9 p.m. It's not kicking in. You think, let me just take a second one because I really need to sleep. So then what you're doing is you're taking more than the dose you should be taking. So you end up abusing that as well. You're taking more, and guess what? Even when you take more, it's still not going to work quicker. You just have, should I say, a hangover the next day. Okay? Another one, Benadryl, cough syrup or Actifed. Now, we've got to be very, very careful the type of coughs that we're using to treat these things. Chesty cough. You shouldn't treat a chesty cough with a dry cough medicine. What am I saying? A chesty cough, you have phlegm. So you need something that's going to expectorate the phlegm and get rid of the phlegm. But somebody will take it thinking, I just want Actifed dry cough because it helps me sleep as well. Because Actifed actually has a little bit of codeine, something to help you sleep and take the ease off. And it's also has a bit of codeine, not Actifed specifically, but dry cough remedies. They have a cough suppressant to suppress that dry cough. So if you now take a dry cough medicine for a chesty cough, what you're doing is you're suppressing that phlegm that you're trying to expectorate. And guess what happens? That phlegm stays on your chest and it progresses to a chest infection. So whenever you're buying a cold remedy over the counter, what you need to ensure is, am I buying the right thing for my condition? Am I coughing out sputum? And if I'm coughing out sputum, what do I need to do? I need to make sure I get a chesty cough remedy. And if it's dry and I'm not coughing out any sputum, I've got to get a dry cough remedy. You see, this is how medicines are misused as well. One last one is Piriton. Oh my gosh, Piriton, it's an antihistamine. When we get itches or we get bitten, we take it. Because the side effect of antihistamine is drowsiness, people go and do a night shift and they'll take 2 and they'll pop off. That's also an example of misusing that medication as well. So what I'm saying is sometimes we use the side effects of that medication, we misuse them for the side effect they're going to produce, not for what they're intended for in the first place. Okay. Anti-malarials. Oh my goodness. And before I was a healthcare professional, I was a little bit naughty. And thank God I now know this. You're traveling, like for example, I was going back to West Africa, Ghana, and Nigeria, and you kind of like, you forget to buy your anti-malarials, and you're like, I'm going to pick some up when I get there. No, the anti-malarials say start before you enter the country. oh, I've got to get it, it's too late. No, please follow those instructions. Please use the anti-malarials when you're supposed to use them, because there's a reason for that. And when you come back, there's a reason why they say use it after you've returned, because that malarial parasite lays dormant for a while, even when you get back. So when you get back to the UK and you think, oh, I'm back in the UK, I don't need to take the anti-malarials. No, make sure you complete the course, because that anti-malarial parasite can remain dormant, and there you go. You get malaria in London, and they treat it as if it's some like horrible disease because of lack of knowledge. Okay. Another thing about I didn't like during the pandemic was they had this whole chloroquine being the amazing wonder drug, and people were buying chloroquine, and people were getting chloroquine drug poisoning. This type of thing you cannot do just because it's easy to get hold of, or Donald Trump, I should be careful how I say this, or some president has said it's really good. Please be careful, use it according to instructions, okay? Right. Now I've just discussed drug misuse. Let's take you to drug abuse. So first of all, we're misusing the drugs because we think we know it all. So we're actually misusing it to treat a specific ailment. Drug abuse is when we actually take it with the intent to abuse. So we're no longer taking it because, oh, I don't know how to use it, or I want to treat myself for longer. We're taking it because we want the effects it gives us, okay? We want to feel the feelings of euphoria, the feeling of I feel great, and we're taking it for the wrong reasons entirely, when we want a buzz. So what is drug abuse? I've given you a few pictures here, and the reason why I do that is I need you to understand examples of it. You see those little white strips? That's cocaine. And the reason why I've actually added the injection there is people abuse cocaine, and the way they abuse is this: they can actually snort it, but then if they actually dissolve it in the ascorbic acid, as I mentioned, it's soluble and they can inject it. And when you inject something directly into your blood veins, the high is immeasurable. It's like you feel you're walking on air. And I'm not talking like I've done it before, but that's what my patients have told me. They said, honestly, miss, because I used to work in a prison, miss, it's undescribable. Because when they inject it, it goes straight to the vein. It doesn't go to the liver. It goes straight to the brain. Take note, I've mentioned the brain. It goes straight to the brain, and the brain releases this chemical called dopamine. And this amazing chemical dopamine, this chemical in the body, it gives you this reward pathway. And when I mean reward pathway, it stimulates the reward pathway, and you feel great. You feel you could take the world on. That's what I've been told anyway. Anyway, so I'm giving you the pictures of how they use it with the injections there. Right. The causes of drug abuse. Why do people even abuse drugs? Number one, curiosity. People have been told it's exciting. You want to feel that way. Peer pressure. And I don't want to digress, but when I say peer pressure, if anyone has kids, nephews, nieces, please be careful of who you surround your kids with. Don't worry, I'm not going to give a child lecture over here, but I'm just saying be careful, because peer pressure has actually got some of my patients into the mess in which they're in now. Another example of cause of drug abuse is when people actually think, you know what, I'm taking this codeine, I really am dependent on it. Somebody who's been diagnosed of, I'm going to say something that like a long-term spinal injury or something, and they become a bit addicted to it. So even though they're meant to take 2 tablets, they end up taking 4. Another one is recreational purposes. People just take it because they just want to feel great. So that's a cause of drug abuse. Flora, sorry, I'm running out of time, so I'll be quick. Sorry, bear with me.
Keep going.
So now I'm going to talk to you about the 3 groups they fall into. Drug abuse. They're depressants. What they do is you take sleeping tablets like heroin, and it makes you feel really good, barbiturates. You feel low. You feel like a colleague of mine told me, you feel fried. That's a term that they're using on the streets now, when your brain is fried because you just can't think. Take note, I said brain. I keep going back to the brain, because what these drugs are doing is they're altering your brain function in the long term. The next one are stimulants. We're talking about amphetamines. We're talking about cocaine. Now with them, they just give you this alertness, and they make you sometimes people just get so high, you see them running around the club and they get this extra energy from nowhere because it's a stimulant. And the next category is hallucinogens. People take it and honestly, they feel they're out of this world. I don't know if you've heard when people say, I can fly, and they go to the end of the top of a skyscraper. I'm not laughing that you hear this. And they're like, I believe I can fly. No, you can't, okay? It's the drugs that are doing it, okay? So don't kid yourself. But this is how much they play with your brain and give you this feeling that you become dissociated from yourself. It's like a second thing. And you're like, you become delusional. Your sensory perceptions are gone, and you think, I think I can fly. And believe me, not many of them recover, sorry to say. So I'm giving an example of how they're used. Remember I mentioned they snort it. They also mix them with alcohol. So I'm just going to give you examples of drugs of abuse. Alcohol, yes, alcohol, tobacco, cocaine, opioids, hashish. When I mean hashish, I mean weed. Oh gosh, I tried skunk. I don't know the other names for it, but there are lots of bad names for weed. Ecstasy. All those things are drugs of abuse that people take as in, oh, let me just try it. One frightening thing I have to say is the new thing that's coming out with cannabis. They're making it into sweets. People are putting cannabis in sweets for school children because what they're doing is they're trying to get these children hooked. So the child would have something called an edible. It's called edibles, okay? So they'll put in THC, which is tetrahydrocannabinoid. And this kid tries it and thinks, oh, I like this. And this poor unsuspecting kid thinks, I want to try it again. And they use their pocket money. And it builds up, and it builds up, and it builds up. And sooner or later, the kid's like, I want to feel fried. They're actually putting it in kids sweets. I wish I put some pictures there. Okay, the next one. Now we're moving to another level. We've now learned about drug abuse. We're going to addiction. Now with drug abuse, the person can control themselves. They think to themselves, okay, I'm going out with my mates, my friends. I can take this about 8 p.m. I'll give myself a shot of cocaine and I'll be fine. No problem. They can control it. However, drug addiction is when you get to that level where you can't even control it and you do anything to get hold of the drug. You can't wait till 6 p.m. when you're going out. You can't wait till 8 p.m. You want it now. And it can actually destroy your job. It can destroy your family life because all you can think about is, I need the drug now. That's drug addiction, and that's the difference. You don't care when you have it. You have an uncontrollable use despite its consequences. And why does this happen? And this is where dopamine comes in. Now, as you can see over here, a little diagram I've got my, I don't know if you can see my mouse moving. Okay, I'm going to give you an example. Dopamine, as I mentioned, is a chemical in your body, okay? When you have a little bit of food, dopamine is just released as a little reward. That's natural. But when cocaine comes in, cocaine causes a larger amount of dopamine to be released in your body. And when that large amount of dopamine is released in your body, your brain pathways are overstimulated. So then that means you feel more rewarded, you feel more on a high, and that's how cocaine gets people addicted. Take note, I didn't say dopamine. It's not all dopamine's fault. Now, how does dopamine play a role? Like I mentioned, a lot of it gets released, your body feels really good, and what happens is that person will then go back because they want that high. So when they get injected, so I'm just checking my time, when they inject themselves, they want that high again. So they go back again. So they go back to the reward pathway. They go back to the reward pathway. But dopamine, what dopamine does, because our bodies have been engineered by God to protect us, our body tries to protect us from this excess dopamine. So what it does is it decreases the dopamine production. It also reduces the dopamine receptors. So now what happens is your body, you start thinking the 10 grams of cocaine is not working anymore. And then you end up taking more because you're like, I need more of this. I need more of this. Okay. But dopamine is not at fault. We need to realize it could be a biological or environmental factor as well. Some studies say it could be the genes. This is the National Institute of Drug Abuse. It could be a genetic thing. It also could be somebody's health history as well. If somebody has a mental health condition, they are at risk of becoming dependent. It also could be home life, who you're being exposed to, and your social influences. So it's not just dopamine's fault. Now, just taking you back and just summarizing just to the last slide, drug misuse isn't a disorder that cannot be remedied. You just correct the person and say, don't take the drugs inappropriately. But repeated drug misuse can escalate to drug abuse. And when it escalates to drug abuse, that drug abuse, if you can't control it, can escalate to addiction. And this is where we need the support of psychologists and also our doctors to start prescribing to help the patient detox. Any questions, please? I'm going to stop sharing, right?
Yes,
Yes, please. Thank you so much.
Sorry about
I think I did see a hand go up. I'm not sure if the person actually had a question. It was Emilia Corride. Do you have a question for Marilyn, please? Okay, while we're waiting for her, I'll have another person, which is Temitope Ekundayo. If you can just unmute yourself and ask a question, please. Thank you.
All right, thank you. Please, I want you to tell us more about spice, because I work with a group of people that use the substance, and sometimes it's very difficult to manage. And I've realized that people are not so aware of the implication of spice. So I just want you to educate us on what spice means so that we can be aware. Thank you.
Thank you so much. That's a very good question. And as you were talking, I was just typing it in to actually tell you in the prisons, because I used to work in Belmarsh prison, and they're very smart about spice. Spice is a combination of everything, because what they're doing right now is they're so used to cannabis, they're used to ecstasy, LSD. So spice is a combination, and that's why your questions actually counts, because you can't manage it because it's got so many different substances in there. So the person feels very sweaty, and many of our prisoners have died because of that, because spice contains so many different, ingredients of different drugs. I've got Dr. Ade Olat there, but if you don't mind adding to this, but all I can say is with spice, we're still learning about it. We're still trying to get our heads around it because of the combinations they're put in. Do you work in a prison? Hello? Hello?
She'll just unmute herself.
I know she works
Hello.
within the
Yes,
NHS.
I work in the prison at the moment, and it's so manic because I keep running around trying to resuscitate on almost a daily basis. So I can't just figure out how to help them. It's really crazy for me almost every day.
Unfortunately, it started off, I think it was 2008, that's when, it's a synthetic cannabinoid, okay? And what they've done with this cannabinoid, synthetic, they've added other ingredients to it. So sometimes the spice you're dealing with is even different from the spice you had last week. So what they're bringing into the prisons, people are just mixing them up as much as they can to get that kick. What you've got to do for the patient, I know you're trying to resuscitate, that's the only thing you can do. Between you and me as well, if you have naloxone, even inject them with it. Naloxone is to protect them from opioid overdose, right? Inject them with it because you don't even know what they've given the patient. And naloxone won't kill them. All naloxone is doing is just in case the opioids are in there, you can actually revive the patient. Do you see where I'm coming from? So you don't know what they've put in, but just to make sure if you have naloxone in your prison, inject them with that as well, just to resuscitate.
Thank you so much for that. Thank you. I'm just going to read. Okay, it says awesome presentation.
Thank you.
Great and very informative. How do we convince a drug addict that he or she needs help?
Oh, wow. That's a powerful question. Thank you for that. I've got the other speakers who will take you onto that. And we've got a psychologist here as well. And we've also got a doctor here as well. And somebody who's actually changed their behavioral. Beautiful question. The thing is, they need to actually accept it and take ownership. You can't just say you're an addict, you're an addict. Some addicts, they're thinking, I'm not an addict, I'm in control. They don't realize that their family life is broken down. They don't realize they've lost their jobs. So it's something that also is not just pharmacotherapy, but psychology as well. So I can tell you the pharmacotherapy bit of it, okay? How can we convince them? It's about, I think it's about working with them slowly, step by step. We call it the 12 steps for recovery, where they've got to have acceptance. Once they have acceptance, you're on your way to recovery. But once they haven't, then, we're not going anywhere. So the only way you can actually help somebody is letting them get the acceptance. And it's not by pointing fingers at them. No. You need to let them find out where they're coming from and where they want to go. Talk to them. Is this where you want to be? Do you think this is helping your family? But right now, remember, they're just thinking, I want my drug, I want my drugs, I want my drugs, you're spoiling my fun. Don't do that. Just try and coerce them, encourage them, let them realize you're on their side and they're not going to do this alone. Because some of them are scared to give up because that's what they know. That's their norm. I'm abusing drugs. That's what they now know. So you need to actually let them know that they're not going to take the journey alone. You're going to be there with them. And encourage them. That's all I can say, because it's very hard to change addiction.
Thank you so much. And we're going to have the last person, but before I have that person, it says, yes, spice is simply concussion in Nigeria, intelligent presentation. And then the last question will be from Galaxy Tab. Would you like to unmute yourself and ask our speaker your question, please? Galaxy Tab.
Hello, sorry, I just want to ask if we can get the slides, because this is a very wonderful topic. I work with homeless young people, and we have issues of drug misuse so often. So
thank you so much. I would like just to say that everything is on
how
YouTube.
To get the slides.
Yeah, and also just to let you know, everything as well is on YouTube. We've got, you know, all the other presentations from the last time. We've got a YouTube page, and everything is there, simply free for you as well. Thank you.
Thank you
so much. Okay, I'll just hand over back to the host, encapsulate, which is Flora Coker. So just please kindly invite the next speaker. Thank you so much, Marilyn. That was really great. Thank you.
That was awesome, Marilyn. Thank you so much. I hope it will put some people off, and you guys are getting lots of information to help other people who might be misusing medicines or illegal substances. Right, so let's go straight to the next speaker. So we've learned what drug misuse is, what abuse is, and what addiction is. But what is the effect of misuse and abuse? So our next speaker is Dr. Yetunde Adiola. She's a medical doctor specializing in psychiatry and addiction. She's been a physician for at least 10 years. She has a private practice in New Jersey in the USA. She's the medical director for the Methadone Clinic, the residential and outpatient substance misuse treatment program for one of the hospitals in New Jersey. So Dr. Diola, over to you.
Hello, everyone. Thank you very much for joining us. I'm just going to I'm going to share the slide that I have. Okay, let's see. Okay, great. So I just want to talk briefly about the physical effect of drugs. And later on, I will talk about the treatment of drug addiction. And my dear, wonderful pharmacist already spoke to us about the misuse and the drug abuse and drug addiction. So we understand that already. And the symptoms of addiction, and when we talk of drug addiction, we are also talking about dependency. So drug abuse leads to drug dependency or drug addiction, whereby that person is completely dependent on that particular drug. And these are the stuff that we see. There is impaired control. Whoever is addicted to a certain drug has no control anymore and is craving that drug, and we go to any length to get that drug, like the previous speaker said. And in the process, they are unable to fulfill their obligations in the family, at work, and in the society. And they use this drug even when it's very risky to get the drug, because sometimes where they go and get the drug, it's like a very risky location, but they will still go and do it. And drug addiction definitely involves tolerance. So they develop tolerance to the drug, and they can withdraw if they don't use the drug. If they are using the drug every day and they stop using the drug, then they can start withdrawing. So the previous speaker already mentioned all this: caffeine, cannabis, hallucinogens, inhalants, opioids. These are just different types of drugs that we have on the street and on the market. Excuse me. So these drugs, they can be legal drugs, but that are being abused and misused. And in a lot of cases, they are illegal. And when we talk of illegal drugs, we are talking of heroin, opioids like heroin and kratom and spice and all this stuff that people get on the street. Now, looking at the physical effect Now, there are a few ways a person can take drugs. So what the drug addicts can take the drugs by injection, or by sniffing the drug, or by smoking it. In the US, vaping is very common. I mean, all over the world now, vaping is very common, and ingestion. So some people, they ingest the drug, like people that abuse cocaine, sometimes they just rub it on their tongue. Sometimes they will dissolve it in water and drink it. So they take it different ways. The effect of the drug on the body can depend on how the drug is delivered. So it depends on how the drug is taken. For example, the injection of drugs directly into the bloodstream has an immediate impact. So that means when somebody shoots up the dope, like heroin, they shoot up the drug, the effect is quick. Within few seconds, they feel the effect. Compared to somebody who's just smoking marijuana or smoking cocaine, or somebody who is sniffing the drug. So the effect takes longer for such people, but the effect lasts longer. It takes longer for them to feel the effect, but it lasts longer in the system because of the way the drug is used. And so when the drug addicts, or people that are dependent on drugs, or people using drugs, when they use the drug, what happens is large amount of dopamine, which is a neurotransmitter that regulates our emotion, motivation, and feelings of pleasure, will just be released suddenly, and we flood the brain, and that produces a high. So that's one of the physical effects. And this is the reason that the people that are drug dependent use the drug, because of the high. They want to feel high. They want that pleasurable feeling. And that's why they keep going back and using the drug. So eventually, drugs can change how the brain works and interfere with person's ability to make changes, to make choices. And drug eventually will lead to intense cravings and compulsive drug use, because they develop tolerance and they become dependent on that drug. And at that point, we know it as drug addiction. So it's no longer misuse. They are now completely addicted to that particular drug. Over time, the behavior can turn into a substance dependency or drug addiction. All illicit drugs, whether they are opioids, cocaine, or stimulants, marijuana, etc., produce a high or euphoria, a feeling or state of intense excitement and happiness, an abnormally extreme degree of happiness or contentment beyond which occurs in normal responses. People who use drugs are using it for the high. And the other physical effects can include stuff like irritability, anger, rage, violence, paranoia, decreased appetite, anxiety, mood swings, infertility, twitchings, unsteady gait. When people are under the influence of drugs, you can see, when you see it, sometimes you can actually observe that they are under the influence of a certain drug, because you see them staggering, they are unable to maintain a good balance, and you see them getting angry easily. They feel paranoid. They feel like people are against them. So somebody may say something to them, they will just flare up and snap at such people unnecessarily. It's because of the effect of that drug that they have taken. We can skip this. This is just talking about the neurobiology of addiction. So we know that addiction is defined as a chronic disease of brain that involves reward, motivation, memory. And these are the parts of the brain that are involved in addiction. Now, we are back again on the physical effect of drugs, whether they are legal or illegal. Substance use disorders, they are associated with wide range of short and long-term effects, health effects. They can vary depending on the type of drug, how much and how often it's taken, and the person's general health. Overall, the effect of drug abuse and dependence can be far-reaching. They can impact almost every organ in the human body. Physical effects of drugs may include damage to the gums and teeth, mouth sores, and dental infection. This is seen in almost all the drugs, especially crack cocaine and heroin. So because when they use the drug, especially if they are smoking it, it's going to touch their gum, their teeth, as they smoke it, as they sniff, as they ingest it, and it can damage them. Damage to the nose, frequent nosebleed, loss of smell. This can also be seen because some people sniff the drug. So like cocaine now, a lot of people using crack cocaine, they sniff the cocaine. And if they continue to do that, they end up with deviated septum, they end up with damage to their nose, they end up with nosebleed, and they cannot smell like they should be able to because of the effect of that drug. They can also have weakened immune system, increasing the risk of illness and infection. Heart conditions ranging from abnormal heart rates to heart attack, collapsed veins, and blood vessel infections from injected drugs. So people that are injecting the drugs, they are at risk of collapsed veins. Their veins, they destroy their veins, they destroy the blood vessels, and they are at high risk for infections. And God forbid, they end up in the hospital and they need to get the IV drip. The doctors, the nurses cannot get a vein because they used up all their veins. And sometimes when they use up all their veins, there's another method that they use. They call it skin popping. So those drug users that are doing the injection, when they use up all their veins, they do what they call drug popping, skin popping. So they just inject it into the skin because they cannot find any vein. And sometimes they will even use veins in the legs. You know, usually they use veins in their arm, but when the veins are all over, they don't have any veins left. Some of them use veins in the legs, and this can cause infection. And I've seen in the hospital a couple of patients lost their legs because the site became infected. They end up with very big wound. And because they did not go to the hospital on time, they lost their legs. Another physical effect is nausea and abdominal pain, which can also lead to changes in appetite and weight loss, leading to malnourishment. So people that are abusing drugs and are drug dependent and addicted, they can feel nauseated. Sometimes they throw up. They have abdominal cramps, stomach ache. They are unable to eat well. They lose weight. They become malnourished. When people see them, they look at them like maybe this person has cancer or this person, but it's not cancer. It's just because they are abusing the drugs. Another effect that can be seen is increased strain on the liver. So they end up with significant liver damage or liver failure. And we can see that with them becoming very skinny, and their tummy becoming very big. So that's part of the liver failure. They can also end up with epilepsy. They can end up with stroke, especially if they are taking stimulants like crack cocaine, crystal meth. They can end up with stroke, movement disorders, mental confusion, and brain damage. lung damage and disease. Lung disease very common because when they smoke the drug, these drugs are toxic to the human body and toxic to all organs of the body, because sometimes they combine stuff, we call it concussion, like petrol. Some people, they sniff petrol and they use all these toxic chemicals and they abuse them. Unfortunately, the drug itself is not just what they are taking. They are taking stuff that are mixed with the drug. So when the drug dealers caught the drug or prepare the drug, they mix it with very toxic chemicals like rat poison, petrol, all kinds of stuff. Now, when they smoke such drugs, they damage their lungs and they end up with lung disease, and they end up with shortness of breath. They end up with different stuff like emphysema, chronic obstructive COPD, chronic obstructive lung disease, and so on. It can have problems with memory, attention, and decision making, which make daily living more difficult. So they are not thriving. People abusing drugs, they don't thrive well. They are not doing well. So because they are like all scattered, the brain is fried from the constant use of these toxic drugs. Global effect of drugs on the body, such as breast development in men and increase in body temperature, can lead to other health problems. And the most severe health consequences of drug abuse is death. Death related to synthetic opioids and heroin are on the rise. So what we are talking about is when the drug is taken and in a large amount, it can cause what we call accidental overdose. So that particular person can overdose on the drug, especially opioids, because opioids decreases respiration. So when they keep taking the opioid, the respiration is going down. Unfortunately, the person is not aware of that. So at one point, that person will just stop breathing and can cause death. So these are the physical effects of drugs. These are not all the physical effects. These are just some of them. Now, when we're talking of physical effect, we are looking at physical effects secondary to withdrawal. So if they are withdrawing from the drug, they can have this kind of physical effect. If they are intoxicated with the drug, it's another kind of physical effect that you will see. Now, if they are withdrawing, like people that are abusing opioids, like tramadol, codeine, heroin, when they stop taking it, or if they are unable to get the drug, they are going to go into withdrawal. They're going to become, they will become nauseated, they will throw up, they will have lacrimation, tears will be flowing from their eyes, runny nose, the pupils may be enlarged or pinpoint. Well, in case of withdrawal, it will be enlarged. If the person is intoxicated with opioids, the pupils are pinpoint. And then they have goose pimples, they are sweating, they have diarrhea, they are restless, they are miserable. They are just not in a good place. So, so that's the effect, the physical effect when they are withdrawing from the drug. They will be yawning, they may have fever, elevated pulse and blood pressure. They feel very sad. They are unable to sleep. They have muscle cramps, abdominal cramps, stomach ache. So these are physical effects when they are withdrawing. And the one I mentioned, the effect earlier, those are the the effects that they will experience when they are under the influence, when they are intoxicated with the drugs. So I will talk about the treatment later. I don't know if you have any questions.
Thank you, Dr. Adiola. Please, could you stop sharing so that we can go back to the
Oh, okay,
gallery?
sure.
Thank you. Fumi, do we have any questions?
Question for, no, not yet. If you have a question, if you just put your hands up or you just unmute yourself and ask our speaker what question you have, please. Okay, seems it was a very good presentation then. So then, thank you so much, ma'am. We really appreciate you. And thank you so much for sharing from your depth of knowledge. I'm going to pass over to the host, who will then invite the third speaker. Thank you.
Fantastic. Thank you so much, Dr. Adiola. Wow, so many physical effects of drug misuse. Is it really worth it? Let's go to the next speaker, who is the Reverend Olabode Daramola. He's a clergyman, and also a licensed clinical psychologist and a mental health enthusiast. He holds a bachelor's degree in psychology and Master of Science in clinical psychology, and also Masters in managerial psychology from the University of Lagos. He also has a postgraduate diploma in theology from Lagos Anglican Seminary. His current scope of work includes assessments, coaching, counseling, training, testing, behavior modification, psychotherapy, employee assistance program, resourcing, and mental health advocacy. He's very passionate about volunteering and was recently a member of the Lagos State Psychosocial Response to COVID-19. So, Olabode Daramola, over to you.
Good evening, Flora. Thank you so much for that introduction. Good evening, everyone. I'm indeed elated to be here this evening. I appreciate everyone for what they're doing. Thank you so much, Marilyn, for a good opening. Dr. Adiola, I appreciate you as well for what you've done. I appreciate our sponsor, that's Victory Drugs. And I also want to appreciate one of my mentors that is here, the Right Reverend Dr. James Olushola Odediji, my father. Thank you so much, sir, for joining. And my wife as well, and all the members of the family listening to us this evening. You are all welcome. So very, very briefly, I'll be talking about the psychosocial effects of drug misuse and abuse, the reason why people misuse and abuse drugs, and then pretty much later, we'll be talking about control as well. You agree with me that the world that we are in now is the VUCA world, a world where there is so much uncertainty, it's complex, it's volatile, and at the end of the day, very much ambiguous. And even pre-COVID, and even in the middle of COVID, people have looked for different ways of coping, especially with loneliness of life. And a lot of people have resorted to drug use, from misuse to abuse, and then addiction. And so look at this quote, that's from Philip K. Dick. Philip K. Dick is an American writer and author of many science fiction. And he goes with this quote very many years ago: drug misuse is not a disease, it is a decision. Like the decision to step out in front of a moving car, you will call that not a disease, but an error of judgment. Each and every one of us have important decisions to make about our lives. Every day as we live, it is a combination of different decisions. So the decision to take a medication is one that must be carefully taken. Before I logged onto this platform, someone that I managed when the COVID-19 was pretty much on the eye called me. Even though she has taken the first and the second dose of the vaccine, she's down with COVID again. And in her hand, she had ivermectin, and she placed a call. She wanted to know whether she could take that medication. I said, I don't do prescription. Let me find out for you. So each and every one of us, before we swallow any dose, it is important that we wait, especially to Nigerians and every other person in Africa, or wherever we're listening from. It is a judgment that must be made with a lot of thinking. So if we make that error, it could just affect everything about us. Like it's been said to us by Marilyn, A medicine is any substance other than food, which by its chemical nature can affect the structure and the function of a living organism. So whether we like it or not, whatever we take as a way of causing a disorder or some form of disease in our body, if we don't use it appropriately, it can alter the function and the operations of the body and our mind when injected, smoked, sniffed, or even swallowed. So the use of medicine for recreational rather than therapeutic purpose is commonplace. You know that, many times people use medicine for commercial purposes. Sometimes it's important that people use it to treat what it's meant to be used for. But at the end of the day, a lot of people use it recreationally. And that way, abuse, misuse is on the rise. The psychosocial effect of this menace on our teeming population in Nigeria cannot be overemphasized. There's so many of it that we'll be talking about. So what are these effects? Can we stem the tide? I mean, is it possible to control misuse and abuse? And then where can we get help in Nigeria? These are some of the things we'll be talking about. But for this section, I will be looking at the psychological effects as well as the sociological effects. But first, look at these interesting statistics. 15% of adult population in Nigeria reported usage of psychoactive substances. 40% of Nigerian youths engage in illicit drug abuse, according to UNODC 2018. So drug use was most common among people between the ages of 25 and 39. Those are explorative ages where people are trying to find identity. So the desire to experiment and seek abstract solutions to problems is partly responsible for the high prevalence of drug use reported among our youth. Almost all deviant behavior is directly or indirectly attributed to drug use. Yesterday, I was discussing with a colleague. There was a bank robbery somewhere in Ondo State, and a brother was shot in that bank robbery. And I said, I don't think any Nigerian will carry a gun and shoot someone if they are not under influence. They just must be under something before it happens. So the incessant unrest, banditry, cultism, kidnapping, and other vices in our society are linked to substance abuse. In Nigeria, cannabis sativa is the most commonly used drug. About 10.6 million people are using this. And then followed by the opioids, 4.6 million. So Northwest and Central Africa jointly account for 87% of all confiscated opiates globally. Somewhere in North Nigeria, 2 states in North Nigeria, Kano and Jigawa states. I got this information very recently. Sometimes in October 2017, the Nigerian Senate stated that 3 million bottles of codeine are consumed daily in Kano and Jigawa states. So you will agree with me that the issue of drug misuse and abuse is staring us in the face, and it is indeed a national issue, much more like an epidemic if we don't call it a pandemic. So what are the reasons? I went to the streets, even on researches, what are those reasons why people misuse or abuse the drugs? Number one, availability of the drugs. The drugs are everywhere. Normally, there's a law in Nigeria that says that in any school, 300-meter radius, there shouldn't be any sale of these substances, but these substances are available everywhere. There are dealers everywhere on the streets. They are just a call away. So people who misuse or abuse drugs because of availability. For students, academic rigors. Some people need to pop something before they can read and understand, or read for long hours. Sometimes advertisement and the media also promote some of these things without knowing. They lead people on. The curiosity and search for experiment. A lot of people just want to know what it means to be high. That feeling you get. When Marilyn was speaking, I remember one of my patients back in the days at the Federal Neuropsychiatric Hospital in Yaba. This boy, after taking whatever he took, he felt the highness, felt like a giant. And he saw all the cars on the streets like toys. So he took a hammer and started breaking all the windscreen before police took him up, and then he landed in the hospital. So I was asking him, why did you do this? What happened? He was only curious. He was in SS2. They just finished their last examination, going to SS3. So he gave it a shot. And at the end of the day, I mean, got back home and started misbehaving. That is what highness can cause at times. And also forced marriage or early marriage. This usually happens a lot in the northern part of Nigeria. 6-year-old girls are married off to a 50-year-old man. And at the end of the day, to men who don't even understand their love language, men who cannot relate with them, they don't belong to the same age. So a good number of them are lonely and they resort to all manners of substances in order to get a good sleep. I wouldn't want to, the doctor has been able to mention a good number of them. I wouldn't want to lead anybody on by mentioning. Some depend on sleeping, I wouldn't want to state that here. And then of course, lack of self-confidence. A lot of people will tell you, oh, before I can get on that stage, before I can perform very well, I must take something. Then lack of parental supervision. Marilyn has mentioned, we need to pay attention to what our children are doing. In Nigeria, we have some people, we call them the science students. Those are the people that do a lot of mixtures. And that's why whatever your children are drinking, make sure it's clear, a clear bottle. There are some people that we call science students in secondary school, not because they are studying physics and chemistry, but they are wine mixers, they are drug mixers. And they do it in such a way that they are perfect. I have met a young lady who says she is a wine mixer, 21-year-old, and she could mix all forms of substances for you without knowing, and you will be in the heavens. So let us, whenever our children are drinking, ask them, what are you drinking? What do you have inside? Is it really water? Do you have any other thing inside? So all of us has a role to play in stemming the tide. So peer influence, that has been mentioned, poor control and failure of our institutions. We have so many institutions in Nigeria that are set up to control these things. How much are they doing? In a population of over 200 million people, it's like dropping, a drop of water in an ocean. The poor economy, poverty, prevention of withdrawal syndrome, as we mentioned earlier. Some people use this medication to reduce stress and frustrations of life. Sleep problems, when people cannot sleep, they just pop thing and then off they go. And the energy, some people need energy to work long hours. And so they are constantly living, even on coffee. And sometimes unemployment and underemployment. The drug business and the environment, it's an all-comer. Anybody could start. They will even welcome you. Somewhere in the north, they rent houses for ladies who are drug peddlers and users. Free. So it's all on the street. But what are the, let's look at this. I've given some reasons. So you now ask me if the reasons are what? A bad brain. Look at this. This is a cross-section of a drug-affected human brain. Our brain is the most complex organ after the eyes. I was telling someone today, I said, you insure your phone, you insure every other thing about you. You must insure your brain. The brain is a fantastic communication system, and that communication must continue for stability. The neurotransmitters in the brain, the dopamines, the epinephrine that have been mentioned earlier, they maintain mood, they are mood stabilizers. And whatever medication that we're taking, especially for psychoactive substances, they will ensure imbalance in the level of neurotransmitters in the brain. And once that happens, anything could just occur. So whatever reasons that people are giving for misuse, and that's pretty much some of the things that we do in cognitive behavioral therapy, so as to ensure that people think appropriately. And so what are the psychological effects? The number one psychological effect of taking substance is apathy, and that is loss of interest. People lose interest in the academics, people lose interest at work, they are not interested about performance, they just want to go on drinking and smoking whatever it is. Anxiety, depression, the soul is being pressed down. A scripture just came to my mind. It says, guard your heart with all diligence, for out of it flows the issues of life. So when people say, there are so many people who think they can get out of depression by taking some of these substances, but it's just a vicious circle. It's not going to work. And many a times, psychosis. And then conduct problems. When people are under medications, they behave badly in so many ways. Impaired learning and psychomotor skills, personality disorders. Personality disorders is one of the very difficult disorders to actually treat. So when people are high on any of these substances, you see them behave, there's something else at home. and there's something else out there, and they switch in between modes. Suicidal ideation, and even attempted and a lot of completed suicide. And that's why 90% of people who committed suicide are going through depression, and a good number of them will use substance before they eventually take their lives. Memory problems, which has been mentioned by Dr. Adeola earlier. So usually when people take these things at the onset, there's this feeling of suspiciousness, inability to sleep, poor appetite for the smokers, excessive talking, and there are so many of them that we can actually explore here. But at least I've been able to mention a little psychological effect. So it's not worth taking any or abusing any of these substances. Then what are the sociological effects? There are so many of them. Number one, for the young people, absenteeism at school and even at work. Another big issue is presenteeism. People are available at work, but they are not amounting to so much. They're just putting in the hours, but you can't see the effort. You can't see the work they are really doing. And it's so common now, especially when people are walking away from office. So abuse of substance encourages presenteeism. You're just there amounting to much. You just log in, but yet you're not delivering. Trancy, armed robbery, and organized crime, I've mentioned that. Cultism, declining grades for students, domestic violence. Some people would, after popping whatever it is they thought, they have the strength to actually beat up their spouse. Examination misconduct, increased dropout potentials. Low level of commitment to education, moral decadence. Misuse and abuse of drugs is an obstacle to learning, because you just find it difficult to concentrate at some point. You're now dependent on the medication. At the onset, it may look like, oh, wow, this is really helping. But at the end of the day, it becomes really bad. Poor performance, rough sleeping. If you go around Lagos and even everywhere in the world, in the UK, we have rough sleepers. People who sleep under the bridge, not like some of them don't even have houses. But when they are on medication, a lot of people don't, when they are on these illegal substances, a lot of people forget to return home at night. Very interesting. Prostitution and high-risk sexual behavior. It goes along with all of that. Rape, sexual abuse, separation, and even divorce. And sexually transmitted diseases because of the illicit sexual behavior, and also trafficking in person, and even in drugs. So there's so many of these things that we can't talk about, but I just want to tell us that even as we are listening, it is important that all hands are on deck to do something about this menace. So as you are listening to me, I want you to think, whatever it is you want to take, I'll give you this, this acronym that I usually give to my patients. The letter T, whatever substance you want to take, I asked you, is it truthful? Meaning, look for the facts. What is it saying? What are the side effects? What is this medication going to do for you? And then the H, is it going to help you? Is it helpful or is it harmful? Before you take it down your throat. And that medication, is it going to inspire you to do something positive? Is it going to make your life better? Or is it going to inspire you to really fight and be aggressive? And then you need to also ask yourself, before you take the next dose of Panadol, is it necessary? And then by the time you take these things, your behavior, is it kind? Somebody say, the moment I take this, I'm aggressive, and I can speak to my parents, I can say whatever I like to them. So ask yourself, think, because when you think positively, your feelings will be positive, and your behavior and actions will also be positive. Thank you for listening. I expect your questions if there are any.
Thank you so much. We really appreciate you, Mr. Olabode. If you have any question for him, if you can kindly unmute yourself and ask your question. I thought that was a very informative session. Thank you so much.
Or you can raise your hand so we can ask you to unmute if you have any questions regarding the psychosocial effects. All right, while we wait for any questions, we have some comments from YouTube. Benevolent says, issues at home, in the family, between parents are taking first position in abuse of drugs by youth and children in recent times. And Ola Taiwo says, unemployment is one of the major factors, especially in developing countries. God help us. So those are some comments from those watching on YouTube.
And we've also got some comments here. Says, thank you so much, really helpful. Another awesome session. Thank you, Dr. Daramola. And if we try to remember the things that he said at the last end, which says, is it truthful? Is it helpful or harmful? Would it inspire you positively or negatively? Is it necessary or is it kind? I think that's a very good way to start. Thank you so much. I'll pass over to the host.
Great. So now some of the things we might be hearing might be like theory. Now we're going to, our next speaker is living the reality of dealing with the effects of drug addiction. His name is Mr. Israel Balogun, and his foundation is Phronesis Life and Value Foundation. He's going to talk to us about his work rescuing street children. Mr. Balogun, over to you.
Thank you so much. Good evening, everybody. My name is Israel Balogun. I am glad to be here this evening. Thank you. I don't know if you can see my screen and you can hear me.
Yes, we can.
Okay, thank you. Today I'll be talking to us about what we do at Phronesis Life and Value Foundation. So we are able to create a free school for homeless street children in Nigeria. And then first and foremost, let me talk to you about myself in just a few minutes. I'm Israel Balogun. I was born in a polygamous family where father has up to 6 wives, and my own mother alone has up to 8 of us. So we grow up independently. My mother tried to raise many of us, actually. She tried, but at a point in time, we were unable to have any resource. One way or the other, I was born a Muslim, I became Christian. That's a long story. But I ended up living on the street myself. I was living on the street, and I was actually living like these children you see here. I was living like them, like this, until I was 22 years old. I was living like this on the streets. I remember I live in under bridge of Ikeja, and I live under the bridge of Mokola, Ibadan. I was like this, and then as I grew up, it became something that one way or the other God inspired me, and then to go back and begin to rescue these children from the street. So we have been rescuing these children for the past 3 years, and to the glory of God, we have successfully taken out of the street up to 20 of them, which have been taken out of the street, given educations, shelters, and then at the age of 22 of my life, I could not write or read. In fact, if you give me a book to read at the age of 22, I will turn it upside down without knowing if it does not have a picture. But when I got inspired to go back to school, somebody talked to me, I went back to school, blah, blah. By now, I am also, I've finished my course, I've done a lot of courses, and I have masters, starting my PhD next year. I presently are qualified to be a behavioral rehabilitator. So these children are addicted to several things, including drugs. As a matter of fact, one of the standards for you to live on the streets is that you must learn to use drug, because without drug, there is possibly that you will not be able to survive. Every of these children you see here, they are taken from the streets to our school, and I will show you to them who they have become after we took them from these states. Look at them very well. And that is why I'm here to talk to us that there is no child without hope. There is hope for every child you see on the street, and there is hope for Nigeria if we can all put our hands together and make something happen. So we have done this for a while, and presently we have these children in our home, and these are the children that I wanted to see them. Now, this is who they are, and this is our home. Some of them now are back to school. They are in GS3, GSS2. When we pick them, they could not write, they could not read, they don't know anything. Their value system has been collapsed. But today, they have been rehabilitated from drug, from behaviors that you can call evil that will need deliverance, but they were able to drop them because we have created a system that could change anybody's life. So here they are in our home, and they are back to school. As you see them, they are doing great academically. We created football team for them. They were playing football now and then, doing a lot of things. Not only that, we say that we did not base it on the outward achievement. We are also concerned about their values, and we do everything to making sure that their values is touched and their life is changed. So we have been able to do this in Nigeria. What is important about these people today is that you need to know that these children, before we took them to our house, they were once upon a time drug addicts. They were once upon a time pickle of pockets. They were once upon a time rapists. They were once upon a time, I don't know, are you hearing my voice or you are hearing voice from this video, please?
We're hearing your voice. Looks like your sound is off. Yeah, we can hear the video now.
I don't want to hear the voice, I just wanted to watch the video. So I don't know if you have muted it.
Yeah, that's fine. We can hear just
so
you now.
Okay, so these are the children we have been able to change their values, take them off the street. Those children you see right here, they were the same children that we picked from the street. So we took them back to the street that we picked them, and we asked them to go talk to their friend and provide food for their friend. And this is where they are. This is what we did with them last year. And they were so happy to talk to some of their friends that they also encouraged them to allow to be ready to leave the street. This is the children right here talking to their friend under the bridge. Many of them, we picked them from this bridge. And so when the other, so those friends of theirs see them, they were like, oh, you that left this place some times ago, look at what you have become. And they were able to talk to somebody. In fact, on that very day, we picked 2 people from here, because some of the children spoke with them, and 2 of them responded and said, please, can they take me too? And I believe it. Look at this girl right at the back. This girl at the back, at my back here, she was picked from this bridge. And she was asked to talk to these people, and they were able to go back and change. So the children that were once upon a time pickle of pockets, road, thieves, they were once upon a time stealing from people. They are now the one going back to change the society and talk to people. So last year, December, we have fun for them, take them out and take them to beach for them to also to go and enjoy their life. Okay, that is what you have done with them. And that is why I am here today to talk about our program. Okay, so what then is Phronesis trying to achieve? Our decision to rescue these children from the streets is purely on the fact that we believe that these children, they are who they are today, not because they are cursed, not because they are evil, but circumstances brought them to where they are. For example, I look at how many people have spoken about drugs, and I could see the picture of what they are saying in the life of these children. In fact, what Reverend said, the last speaker, Reverend Olabode, what he said was purely truth. Okay, when children grow up in a family where father and mother are no longer together, the father abandoned the mother abandoned the child, and the 2 of them asked the child to go and survive on his own. The child will have no choice than to find a way of surviving. These have been the reason why many of them end up on the street. As you look at them, many of them does not know where they come from. I can tell you for a free, we have up to 4 of them in our home right now that doesn't even know where their family is. They don't know where their father is. They don't know anywhere. They left home maybe at the age of 5. They just woke up one night, just stood down one night and saw one car and entered the trailer and followed the trailer to wherever it's taking them to. And that's how they end up where they are. And they live on the streets, scavenging from the dustbin, picking pockets, picking this and that, and also living on drugs. I can mention names of drugs that these children have been exposed to. They have smoked unimaginable drugs, unimaginable drug. You cannot believe that a child of 12 can be taken, and you have to take it. Actually, if you don't take it, how do you want to survive? They sleep in the cold. I showed you the other time where they sleep. Look at them. This is where they sleep. Let me show you the one that is. Look at them. This is where they sleep, in the open. When it is raining, this is how they sleep. When it is, it is whatever is happening, this is how they sleep. And believe me, before you can sleep at this place, you must pay 200 naira per night. They still have superiors who monitor and manage their lives. They must pay 200 naira before they can sleep. And so if they are sleeping there every day, they have to live on drugs, because many of them, they come in the night to rape them. People come to rape these guys, these small children, as you see. They come in the night to rape them. They come, many of them also, because our process is when we find you, we take it to your parents. You can see that I took some picture with some parents. Let me see if I can show you some of the picture we took with some parents. Okay, this boy, this is the father of this boy. This father is living just 10 minutes away from where this boy is living outside. He never dared to look for him. All question that, why did you look for him? He said the boy was not serious. Okay, do you believe that I've taken this boy away from the streets 2 years ago? Over 2 years, the boy has been with us. This man did not show up once. So that suggests to us that it wasn't the boy that ran away from home. It was the man that chased him away. The boy will keep on asking, why did my father come and see me? I have pleaded with the father so much. The man didn't show up. So that suggests to me that it is not even the fault of the boy that make it to live on the street. It is because the father chased him away. These children need to take drug, because if they don't take the drug, how will they survive? They cannot survive. And most of the time when they make money, they know nothing to make. There's nothing to do with the money. It's either they hit with the money, they take drug with the money, or that money must not sleep with you that night. Because if you sleep with the money, you will never wake up next day to get it. Somebody will have come at night and pick it. People come at night to beat them. People come at night. So we've decided to start a school. We call it, and that's what I just showed you where we started. We call it Friends Life and Value Foundation. Is having Phronesis Academy is the name of the school, but this is the foundation. So free school for homeless street children. We created that school. We give scholarship to the children on the streets, and we want to do more. But the one we can handle for now is just 20 children. But I tell you, there are hundreds of them crying for help every day, looking for who will support, who will take them out of that street. Many of them want to leave, but there's no one looking on them or helping them. So I was so privileged to have this opportunity to talk on this platform about what we do at Phronesis. And then here I am explaining to us what we do. Before I will also call it a day, I also want you to know that we have decided to build a physical school, a school with boarding house. That school with boarding house is projected to accommodate at least within 300 to 500 of them. But we are not going to have 300 to 500 at a time. And we are not going to complete the building for 500 children at a time. We can start from moving from 50 to 100, having an accommodation, and then having a school. So when we pick it from the street that way, you are coming to our facility with a full scholarship. That means you are going to be catered for academically, we are going to be catered for educationally, and then it's a mandatory before you finish your SSCE that you learn a vocation. So we have designed a curriculum that will make them to learn a vocation, because we assume and we plan that our sponsorship, that is official sponsorship, should be terminated after WAEC. The child should be able to stand on his own anytime. That does not mean we are abandoning the child. But if a child could write a WAEC in our foundation, we believe that child should be able to stand and proceed in his education without even anybody giving him money, because there are thousands of them that we need to rescue. But what is our end goal? Our end goal is not to rescue children every day from the street, because as you rescue this one, others are producing more. So you just go there today, you take 10, before you go back, you're already 20 there. So our plan is to do this and then gain the grant to begin to influence the federal law. The law that will place a ban on some of these things, that will make it mandatory for a man or a woman to take full responsibility of their child. That will make it difficult for anyone to have the child living, because if the child can be taken, not only will the child be taken away from the parents, the father, the mother will be dealt with. I want to believe some of you live in advanced country, and you can tell me if the country will allow such to happen. Some of you live in England, maybe you are hearing me from Canada, from America. Will government of that country allows anyone, any parent, to have his child living under the bridge? Apart from the fact that the government will take the child away from you, I believe that the parent also have a consequence of that action. And so that is exactly what we are projecting on, where we are intending to go. That at the time, it will become crime to do this in Nigeria. I don't know if I still have more time, so that I will not use much time.
You have time. Keep going.
Okay, thank you. So that is our end goal. That's our plan. Our plan is that one day in this country, we are going to influence government, and government will make it a taboo for you to have a child sleeping on the street. I don't want to show you some horrible, ugly pictures. I don't want to show you, because I am careful to protect the right of these children. But I can tell you for a free what these children has passed through. You will not believe. Now, one of the standard of our operation is that, look, if you are taking any child from the streets, we must do comprehensive test for that child. So in other words, you must test the child to know what is his health status. I want to tell you today, 4 out of 10 children that we pick. Am I correct? Let me say 4. Don't let me say more than 4. Yes, let me say 4. So that will make you have peace of mind. But 4 out of them that we pick from the streets are either positive to HIV, hepatitis C, B, or A. Among others, they have kidney problem, appendix, different, but those are major occurrence diseases amidst the children on the streets. And the question remains that these children, how did they come by it? Because many of them are exposed to prostitutions. As a boy of 10, 12, they're already visiting prostitutes. As a girl of 8, I have one that I did not show the face of that girl because we cannot show her. We picked her. I took her one night. I went out to go and rescue in the middle of the night, and I was seeing a Marua. One Marua was just shaking. So when I got to that Marua, I want torchlight to see. I saw this small girl. Somebody was sleeping with her in that Marua. It turned to a fight within me and that person that, why will you do this? Eventually, when we took that girl away from there, we conducted tests. She's already positive to HIV. That is the life they live outside. But it's a burden on us. The burden is that we will see this menace come to an end. And we call on everyone watching us right now that are willing to support. What we intend doing is, you can give sponsorship to a child. You can give a child scholarship. We say, okay, this child, you take it from the streets. I will be responsible for his or her education, her shelter, and feeding. She be under your care. I will take care of her. And then you, the individual that's doing that, also we have opportunity to raise the child, inculcate new value to that child. You can take that and say, I'm giving scholarship to a child. You can also say, okay, I cannot afford scholarship right now, but on a monthly basis, I'm going to support what you do with this. Or you can say, look, I cannot commit myself to monthly basis. I'm going to give you anything I have at any time. That is monetary. Apart from that, I've listened to some experts on this platform, and I'm pleading to them, please, I would love to work with you guys. I have difficulties going into the adults. Let me tell you my difficulties, because I know the way they think. I have been on the street as well. You know, those adults, their own problem is more dynamic, more difficult to handle. But I know how to handle them. So if I can form a team with the professionals who are on this platform, and we can eradicate drug addictions amidst young, I'm not talking about children now, I'm even talking about the adults, those ones that have grown up. Presently, I am working with some of them. We have a synergy with Association of Vocational Training in Lagos State. Our agreement with them is that we will bring these children to you to learn a skill. You will help us train them, and they were willing to take them. But we have not been able to figure it out, because how do I deal with their high level of drug addictions? How do I handle it? How do I make sure that these children, I am a behavioral rehabilitator, I can change any behavior in you, but all about the drug, the power of drug have taken over you. So I'm also calling for experts, people who can volunteer, who can form a team together, and we can see an end to the menace of street children in Nigeria. God bless you, ma. Thank you very much.
Oh, heartbreaking. I don't even know what to say. But thank you for at least taking the step to begin to help these children. I don't know what to say. People have been asking for how to support, but you had the details at the end there. I hope everyone who has indicated they would like to support has taken the details down. We can share again later. If anyone hasn't got the details, just
for if anybody want to contact, 070-192-77557. I will drop it in the comment as well.
Yeah, just put the details in the chat, the bank details and your contact details also in the chat. I know there's some questions, but we'll take that at the end. I just want to get through the last two topics that we have, and then we'll take the questions. So it's back to Dr. Adiola. She's going to talk to us about short and long-term treatment for drug addictions. Dr. Adiola, over to you.
Okay, I'm going to share my screen. Ooh, where is it? Where is it? Share screen. Okay.
It's not. Is it not moving?
I need to get help. I don't know what happened. It was going well before. Stop share. We are sharing. It says I was sharing, but I cannot.
Yes, you did share, but we couldn't see your slides.
Oh.
Okay, so while you're trying to do that,
okay, I think okay, you can go ahead. I'll try and figure this out.
All righty. Okay, so while Dr. Adiola is trying to get that up, I'll go to the questions. Mr. Balogun, please put your details in chat. Okay, let me go back to the questions. There was a question from Oluwatoyi Towobola. Please raise your hand and then you can put your question to any speaker who can take it. Just raise your hand and I can get you to unmute, please. If she's still on. Okay, I can't see her hand raised. Let's see. All right, if anyone has a question or comment, okay, there we go. You can raise your hand and they will take them.
Hello, good
Yeah, go ahead. Yeah.
Yes, my question is, fine, we know that this thing is happening all over. Can you hear me, please?
Yeah.
Yes, we know that it's happening. But I'm afraid of something. Fine, there's lots of this nylon drugs, this nylon gin and all that selling around. Even everywhere in Nigeria, all the corner of Nigeria, we can see them selling this 50 naira, 100 naira alcoholic that they put in nylon. Anybody can buy, even the children can buy. The mother will sell for them, even those women that are hawking can sell for them. And they also mix a lot of them together. But I don't know how to call it now. Rishi, they put them together about 3-4 mixture and they drink. I'm not saying that fine, they are taking this thing because there's law, but there's no effective. The law is not implementing what it's supposed to do on drug and illicit drugs and all that. I'm not saying that as an NGO, because I know we have about 60 people over in this meeting now. Can we do a lot of advocacy to governments? Fine, if they want to buy alcoholic, let it be in the old age that they are in a bottle. And when it is a bottle, no, it's expensive. So children cannot even go and buy chocolates or the adolescents. It's only the youth, and even youth without 18 years old cannot even buy, as what is going on in international states, countries. Can we, as an NGO, drive our advocacy towards that? That's my question, please.
Are you addressing? Is it to a specific person or who? Or just the speakers in general?
The presenters. I'm talking to every presenter, please.
All right, that's fine.
Let's just think of how to drive our advocacy towards reduction of selling this illicit drugs or alcoholic things in a nylon paper like 1,500 naira that they are selling now. It increases more abuses to the drugs used among our youth. Thank you.
Okay, Halabo, did you want to take that?
Yes, thank you very much for that particular question. It was pretty much one of the questions I was going to address when we get to prevention and control. Like she has said, substances packed up in sachets, they are all over the place in the country. But at every bus stop, somebody selling something. Like she mentioned, Nigeria is good at making laws, but enforcement is a major issue.
Yeah.
And like she is saying, we need to take our work to the streets. A lot has been done in research. And of course, whatever it is that we're doing here is an opportunity to also educate people. So like there are so many roles that people can play, which is pretty much, maybe I should even talk about it now. The family has a role to play in all of this before people get to the streets. It is important that we start drug education from home, at least before the average age of onset. The average age of onset for substance is about 10 years old. And of course, psychologically, the personality of a child is formed by age 5. So before your child is 5, begin to talk to them about the effects of these substances. The family is the smallest unit of the society and is our first line of nurture and the last line of defense. To everyone who is hearing me, let this be a topic in your home and discuss with your children about it. There be care, supervision, modeling, and monitoring. And then she mentioned government. There's a lot that the Nigerian government can do. Government needs to improve on enforcement. Like I mentioned here, we have a law in Nigeria. It says that 300 meter radius of every school, there shouldn't be a place where any psychoactive substance is being sold. But in some universities in Nigeria, right in the hostels, there are drug peddlers. And so our school curriculum should accommodate drug education from primary to secondary and even tertiary levels. The Residents Association, within where I stay, the Residents Association at a point had to organize awareness, and they gave opportunity. Phone lines are available for, children or people to actually call in order to speak. We need to begin to talk about it. And even our traditional rulers should educate, via crying. And even in small communities, this education should go on. so that people will know the destructive nature of some of these substances. There must be increased awareness and even advocacy. You know, I saw on the chat somebody, you know, talked about what the church can do. You know, I was expecting that question.
We will talk about that at the end.
Okay, we'll talk about that.
During your session, we can deal with that one. But I think Dr. Diola is ready now.
Okay,
so thank you for that answer. So let's get Dr. Diola to give her presentation.
Okay.
Dr. Diola, over to you.
Okay, very good. Hi, everybody. Thank you for joining us and for staying with us. And I hope that this discussion has been beneficial to every one of us. So I just want to talk about the addiction, the treatment of addiction. And you know, when we talk of addiction, we are talking of different drugs. So we have the stimulants like crack cocaine, crystal meth, and then we have the sedative hypnotics like benzos, such as alprazolam and lorazepam, clonazepam, and then there are others like marijuana, hashish, spice. Then we have the opioids, such as codeine, tramadol, heroin. So the treatments are different. They have one thing in common. The one thing they all have in common is the psychosocial aspect of the treatment. Everybody has to go through the individual counseling as well as group counseling, and they have to work their recovery once they get to that stage. But talking about the treatment, there are two parts to the treatment. We can look at it like short-term treatment and long-term treatment. Now, in medicine, we call it detoxification. So people that are using drugs, first and foremost, they have to go through detox. That means they are to get the drug completely out of their system. So that's detoxification. And we have different medications that we use for that. So usually detoxification is done in the inpatient setting, in the residential substance abuse program. So they have to be on the unit. So that we can administer the necessary medications and monitor them closely. Because when they are going through withdrawals, that's when we do the detoxification to clean their system completely of the drug. So when we talk of detoxification, in terms of opioids, the same medication that we use to give them the long term is what we also use in detoxification. So some patients, they don't want long-term treatment. They just want to get the drug out of their system and they think that's the end of it. But we know from literature and practice that detoxification is not the best treatment. The best treatment for drug addiction is what we call maintenance therapy. So let's quickly talk about detoxification. So somebody, for example, somebody abusing heroin or tramadol or the cough medication, and they need detoxification, because when they stop taking this medication, they're going to go into severe withdrawal, and it's not pleasant at all. So we can detox them with the methadone or buprenorphine. Those are the two medications we can use. So basically, we just start them on a small dose and wean them off. Within a week, they are done with detoxification. Plus, there are other medications we use. Excuse me. We call them symptomatic treatment. So during that withdrawal state, when they are withdrawing from the drug, if it's opioid, these medications are very beneficial. So basically, we are just treating the symptoms of the withdrawal when they are withdrawing. So they can become nauseated and they will start throwing up, and then we can give them antiemetic. So medication like ondansetron, we can give them PO, IM, IV, and we monitor the EKG. We can give them metoclopramide, which is also good for nausea and vomiting. In actual fact, ondansetron is the nausea and vomiting medication that we also use for people with cancer. Because people that have cancer and have to take the chemo, they throw up all the time. So that's what we use. So ondansetron is really very good for the nausea and the vomiting. And then myalgias. So when they are withdrawing, they have body aches, they have muscle cramps, muscle twitching, they have pain everywhere. So for that, we give ibuprofen, which is a very strong pain medication. It's anti-inflammatory, and it has to be taken with at least a little bit of food. It can be very harsh on the stomach lining, and can cause gastritis if used for too long without food. And then there is diarrhea. Some of them will have diarrhea. We give them loperamide for diarrhea. If they are unable to sleep, if they have insomnia, we have different options. So we have trazodone, hydroxyzine, diphenhydramine, and we try to avoid the benzos. So stuff like clonazepam, zolpidem, which are habit forming, we try to avoid that. And then we also treat them for anxiety, because when they are coming off the drugs, they are severely anxious, they are paranoid, they are miserable, very cranky, they lash out at staff. So these are the medications. Sometimes we give quetiapine as needed for sleep, and then we can, for anxiety, and then we can also give a little bit of diphenhydramine or hydroxyzine. That too can help with the anxiety. And then there are autonomic symptoms like sweating, they have fever, they have chills. So this is basically just like withdrawing generally from opioids. If we give them clonidine, that helps. It takes the edge off. It may not completely help with the withdrawal, but clonidine is really very good. We have to monitor the blood pressure because it can drop the blood pressure. So these are the medications that we use, like we call them supportive treatment or symptomatic treatment of treatment of addiction. Now, the best way to treat addiction is by what we call medication assisted treatment, MAT. And for opioids, we have 3 main medications that are extremely good. They are FDA approved for this particular indication. So methadone is extremely good. It's a full agonist at the mu receptor. It's liquid. The people addicted to drugs, they have to come to the clinic every day. They drink the methadone, and it takes away the withdrawals. It takes away the cravings, especially when you combine it with psychosocial treatment, like the 12-step and the group therapy and stuff like that. The second option we have is buprenorphine. Buprenorphine is also an opioid, but it's a partial agonist at the mu receptor. So the way this thing works is when they take the drug, it goes to the brain, it binds to the receptor, and then that's how the effect will come up. So that's when they feel the high, and then they feel good, rushing around, talking very fast, full of energy. And then when the drug is coming out of their system, they feel miserable, they are sad, they are withdrawing. So buprenorphine is very good for both to treat the withdrawal symptoms as well as maintenance therapy. Now, the withdrawal symptoms, we just treat maybe a week, it's all over. But when we talk of maintenance therapy, we are talking of a lifelong treatment. So it can last 1 year, 5 years. And I've seen people on this medication for like 15 years, they are still taking it. Even though now they have achieved what we call abstinence. They're completely abstinent from the drug. That means they are not using the drug, but they still continue taking this medication because this medication prevents relapse. So methadone is extremely good. It's a full agonist at the receptor. The mu receptor is the opioid receptor in the brain. And then buprenorphine is partial agonist. It's extremely good. Plus, we need to I need to let you know also that these medications also help with pain, because a lot of people that are using drugs, sometimes they are using it for pain. They started using like tramadol or codeine for pain. and then they get used to it. The body get used to it. They develop tolerance. They become dependent. They become an addict. So methadone is good for the cravings and it's good for pain. Buprenorphine, very good for cravings and able to maintain, it maintains abstinence, prevents relapse, and it's also good for pain, especially if we give it to the patient twice a day. It can be taken once a day because all of them can be taken, methadone, buprenorphine with naloxone. They can be taken once a day. They are very long acting, up to like 70 hours half-life. So once a day, they are good to go. But if the patient has history of chronic pain, you may want to divide it and give it like twice a day. And then the third one, the buprenorphine / naloxone is the same. The only reason that the doctor, a genius, somebody came up with the idea is that in 2000, they approved buprenorphine for opioid use, right? And then some drug addicts, they crush it and were injecting it, and some people died because it's a very potent drug. It's opioid, so basically we are using opioid to treat opioid. So we call it opioid replacement therapy or maintenance therapy. So they came up with the naloxone to prevent them from misusing that buprenorphine. So if they inject it, the one with the naloxone, they are going to go into withdrawal. They will never try it again. It's very, very unpleasant. I've seen it before. So that's the second one. And the third treatment is the naltrexone. Now, naltrexone, it comes in form of tablet. We have it 50 milligram tablet, and they usually take one tablet every day. And that's a full antagonist. So what it does is it binds to the mu receptor and completely block the receptor. So that means that if you're a patient, take that naltrexone and then try to use the opioid, any opioid, codeine, tramadol, they will not get any high from it because the naltrexone blocks the receptor completely. And so once they know that, that's why it's better to give it in form of injection, because sometimes they know that, right? They will not take the naltrexone. If they are thinking, oh, maybe tonight my friends are coming over and we are going to have a party and use drugs, opioid, they will not take the naltrexone. So fortunately, we have naltrexone and extended release. The brand name is Vivitrol, and it's given once a month intramuscularly in the butt. We usually use the gluteal muscle because it's very big muscle. So when they get it, we give it every month. Once they get the injection, they cannot manipulate it. They are free to go. They cannot get high. If they use any codeine, whatever, they cannot get high because the naltrexone already binds to the receptor, and so once they know that they cannot get high with it, then they just stop using it. So these three medications that are very good for the treatment of opioid. And then we combine it also with the psychosocial aspect, like I said, the group therapy, the individual counseling with counselors, and the 12-step and stuff like that. Okay, we can skip this. Methadone, like I said, is very long acting and is given once a day in the methadone clinic. Buprenorphine is FDA approved, and we have different types. We have it in form of tablets, in form of films. I'm not sure whether we have the implants in Nigeria, but but some countries have buprenorphine implants, which the doctor we have to implant it just under the skin, and it's good for 6 months. This is very good for patients that are non-compliant, because once you put the buprenorphine implants under their skin, it's released into their system slowly but surely. So every day they get the medication, and it's good for 6 months. So they only need to do it twice a year. So, like I said, buprenorphine is partial mu agonist, and at the receptor is very long acting. Like I said, can be taken once a day. The half-life is 20 to 70 hours. Once the patient takes the buprenorphine, if the patient go back and try to take any opioid, there is no high. The patient cannot get any effect from that opioid. Well, some people also still abuse the buprenorphine. Even methadone can be abused because it's a full, it's a full agonist. So all of these medications they are also classified as opioids, but they are extremely good if the patient is interested in abstinence, is interested in recovery. When we give this medication, the patient has to work his or her own recovery and make sure that they follow the doctor's instruction. So it's just talking about how we do the buprenorphine treatment. There is something we call induction. So the first day they come to the office, we induce them. That means we give them the buprenorphine. They have to be in withdrawal before we can give them the buprenorphine. And after that, they'll, once they take the buprenorphine, within 24 to 48 hours, they'll feel much, much better. So it's available, like I said, in tablets, in films. And I'm also aware that they have it in Nigeria. So that's a good thing. So we can start the buprenorphine and we just give it to them. Sometimes we start like 4 milligrams, and then the following day we can increase it to 8 milligrams. We can go as far as up to 8 milligrams twice a day. The maximum dose is 32. We try not to go over 16 milligrams because by then almost all the receptors are filled up in the brain. So there's no need to give very high dose. Even with 16 milligrams a day, most people do very well. Okay, before I move on, there's something called Narcan or naloxone. Now, naloxone is different from naltrexone, but the mechanism of action is the same. They are opioid antagonists. So the naltrexone is the tablet and the injection that we give to prevent relapse. But there is something called naloxone, which is given to reverse the opioid. So let's assume you find somebody on the floor passed out from overdose of opioid. You have to give that person naloxone to wake that person up, or else that person will die. So the naloxone comes in form of spray. You can just put it in the nose, spray the naloxone, the person will wake up. It also comes in form of IV, and it can be given IM too. We don't give it orally because it's not absorbed orally. Oh, I think this is the wrong. I think this is the wrong slide. Can we ask some questions while I get my daughter to fix it for me? I'm sorry, because there are 3 different slides. I think this is the wrong one.
All right. Okay, you can stop sharing for now and let's see if there are any questions. Any questions for Dr. Adiola on short and long-term treatment, please? All right, Toyin, go ahead. Just unmute yourself, please.
Yes, thank you very much, Dr. Adiola. In fact, I'm happy to be part of this meeting. But my fears and the challenge of many parents is the expensive, like the treatment, rehabilitation is very expensive. One, because majority of the poor people, let me say the masses now, are unable to support their children out of these drugs intake. Because when you go to any rehabilitation center, it starts from 250,000. How many parents can afford this? Can you please look into this for us? Though my child is not taking any drugs, but I can see what is going on in our community. I am an NGO and I work severally in Lagos Island at Petty Street. I work in Lagos Island and I see what is going on at Petty and at Agarau area. So I always feel for parents, because when you hear the spoken English from some of these children, and they are not more children, but they are not adults. When you hear the spoken English from when they are talking, you say, wow, but what leads you to this? I had an encounter with a child, a young man, a youth. His mom has a school, private school at Lekki Phase 1. This child said, Mommy, I want to get out of it. My parents have tried, but I don't know. They said they are tired of paying the money. So how can the rehabilitation center bring or lower the price for masses? Because like that boy now, their parents they have money, they can afford it. Lots of parents cannot afford it. How can we do that? How can we support them in reducing your fee? Thank you.
Right, if there's anybody who wants to answer that, I'll open it to everyone. Anybody here who wants to answer that? Because the drugs themselves that are used in these treatment programs are very expensive. So I don't know how their service fees may be reduced or so and so on, unless they're subsidized maybe by the government or something. Is there anyone that wants to contribute to that question? You can unmute yourselves. I've made that anyone can. You can unmute yourself if you want to contribute.
Sorry, Flora, what was the question, please?
About service providers in treatment centers, how they can reduce their price. For example, in Nigeria, because the costs are really high.
I think what they have to do is, sorry, should I do that or?
Yeah, go on.
Okay, what we do over here is, what we do in the UK is we tend to buy in bulk, and we'll contact the company. And for example, let's just say it's Pfizer selling their drugs. So we'll contact them and we'll say, we'll buy this percentage. Would you give us this amount of discount? Okay, so if you have a few service providers, what you do is service provider A, B, and C, you all collate together and you buy in bulk. So that's much more of a discount because you're bulk buying. Rather than as opposed to buying it on your own, you won't get much of a discount. So what they need to do is work together and get bigger discounts by buying in bulk. Does that answer the question?
I mean, it's one suggestion. I don't think,
okay.
Yeah, Olabede wants to, yeah, go on.
Yes, I just want to add to that.
Your video is off.
Oh, okay, sorry. Sorry about it. I think I'm on now.
Yeah.
The unfortunate thing is that most of these medications for treatments are not even manufactured locally in Nigeria. So it makes treatment, very expensive. But in the drug world, we have worked, and in the Federal Neuropsychiatric Hospital in Yaba, we used to have friends of the hospital. And these people come around like NGOs who assist, especially to pray, assist the patient that are, a good number of indigent patients. And so these people make contributions either quarterly or monthly, and just like it has been said. And that's why we need to speak more about prevention and control of these things, which we'll be talking about later, because it's not really easy to get treated. Like, let me give you an example. If you have to be admitted to Yaba now, there's an holding ward now because of COVID. And you spend about 2 weeks in that place before you get to the main drug ward. For that 2 weeks, admission is 100,000. And when you get to the main ward, for 3 months for detoxification and psychotherapy, the 3 months you'll be spending there, you will not spend less than between 250,000 and 300,000 naira. So a lot of NGOs do come in to assist, but we need to do more. Thank you.
Thank you for that. Dr. Adiola, how many slides have you got left because of time? So that we can go to the very last session. And we have quite a few questions to get through. Okay. Is that the last slide? You're on mute.
Okay, so this is the last slide.
All righty.
So opioids are very, very common. So I went into the 3 different medications we can use for opioid drug addiction. So in terms of stimulants and marijuana and the other drugs, we don't really have maintenance therapy that are well established. Now, for crack cocaine and other stimulants, we usually just give topiramate, which is anticonvulsant, and we use it also in psychiatry for mood. So it's a mood stabilizer. And so we use topiramate. We can also use gabapentin. These are all anticonvulsants that can help with relaxation, help with anxiety. And in terms of cravings, they don't really help that much with cravings from looking at the literature. But so far, we don't have any FDA approved medication for stimulants. Now, we can also use baclofen, a muscle relaxant, gabapentin, anticonvulsant, chronic, and also they use it for chronic pain. And sometimes we use propranolol, which is a beta blocker. It's originally manufactured for blood pressure, but it can also help with anxiety. So basically for stimulants and marijuana, we are just going to treat the treat the symptoms. So we see a lot of depression in the people abusing stimulants, marijuana, LSD, ecstasy, hallucinogens, and stuff like that, spice. So these medications are good in terms of treating the symptoms. But when it comes to recovery and maintaining abstinence, they have to just do the psychosocial, like the counseling and the group, and they have to work their recovery by, sticking to the treatment. For marijuana, there is no specific medication. Sometimes we use gabapentin for them too. So there are different psychosocial treatment, like the counseling, the 12-step, contingency management. This involve frequent monitoring and reward for good behavior. So when they are in the program, in rehab, or even outside, like in the clinic, they come for the program. So if we check the urine, we do urine toxicology, and there is nothing in their urine. So that means they have not been using. If they use any drug, when we do the urine toxicology, you will see all the drugs in the urine that is in their system. Now, if the urine is clean, then we can give them a token, some kind of reward. Even some rehab, we give them a small amount of money or something useful to them. And this is what we call positive reinforcement. So they know that if they can continue to be clean, they will continue to get the reward. So that's part of the contingency management. And I think that's about it. I don't know if we have questions.
Thank you so much, Dr. Adiola. There is no question yet, but you can unmute yourself if you do want to ask any question. And I know it's a lot to take in from the whole presentation. Please don't forget to follow us on YouTube and on IG as well if you want to be updated about other further events. Thank you so much. Anyone want to ask any question, you can quickly unmute yourself before we introduce the next speaker. Okay. No question.
All right, okay. So just a comment about the licensing of alcohol and preventing children from buying. There was a comment in the chat from CEGA. For that to happen, wouldn't everyone selling alcohol need to be licensed? Which she says, which I believe is not the case in Nigeria. And I think I agree with that. I don't think that's the case. There needs to be a lot of work done for laws to be implemented. I don't know if the laws exist already about licensing for alcohol. I don't think I've ever heard of them, but yeah, I don't know if they exist. But if they exist, they're not being implemented at present. Okay. So last speaker, thank you all for hanging in there. I know it's a long one, but it's very interesting and it's a topic that we need to tackle. Thank you for hanging in there with us. Olabode will talk about prevention and control. And as he mentioned before, how can family help? How can the society help? Is that right, Olabode? That's what
yes, thank you very much, Flora.
All right. Yeah, and so after him, we'll take questions. So please, if you have any questions or even comments, When you finish, just raise your hand. I will take them. Yeah.
Like, thank you very much, Flora, and I pretty much appreciate everyone that has spoken. You know, each and every one of us has a role to play in all of these that has been mentioned. You know, when we talk about prevention and control, people will tell you prevention is a science. But for me, I think it's much more than a science. We need to get into action here because it involves limiting the problem that is associated with the use of these substances. And then, of course, we need to provide education and support that is necessary to reduce drug dependency. And so drug control refers to the intervention aimed at reducing the size of illegal drugs, drug markets, and the harms caused by these illegal substances. So when we talk about P and C, you know, we need to reduce availability and accessibility to substances, and also empowering people to say no to substance abuse. And that one is very, very important, especially for our young population. Like I've said before, in Nigeria, we are good at making laws, but enforcement is a major issue. There was one day in the country that we woke up and the House of Rep was planning to legalize the use of cannabis. And I was asking myself, in Nigeria, are we even ready for all of this? I mean, I screamed. I don't know if they are still thinking, I don't know what they are doing at the moment, but hey, even the ones that we have out there, we're not doing enough. Well, here, starting from the family, what can we do? Like I've said earlier, family is the first line of nurture and last line of defense. Everything, the discussion we are having now, I have my 11-year-old beside me here. He is also learning. And each and every one of us must tell our children about it, our cousins, our brothers, our niece, our nephew. Communal parenting is very, very important. You know, gone are those days when you do something on the street, anybody can beat you. But now you caution children in the school. Some parents even beat teachers. Some parents, you know, they go to school and beat up teachers. You know, I put a picture here. Back in the days, we didn't know the difference between cousins and distant cousins, nephews and nieces. Everybody will come together and we eat together. Nobody wants to kill anybody. When no mother would tell her son that the father's people are evil, when there were no half brothers and half sisters, we were simply brothers and sisters. We need to go back to that age of communal parenting. I see a lot of people on the streets. You could, looking at their eyes, how thin their eyes are. Young people, you could see that they are doing drugs. But sometimes to walk up to them, even when you talk to parents, they see you as, oh, wouldn't you just mind your own business? You know, we are all addicted to one. I've seen parents, you know, told me we are all addicted to one thing or the other anyways. So young people need attention. Pay attention to your children. Currently, I'm handling a patient who, very charming and loving, all of a sudden, he became withdrawn, not talking to anybody. Sometimes parents miss this thing. So we need to pay attention. We need to care more for our children. Don't just ship them up to school. By the time you put your children 16, 15, you send them abroad without monitoring. Even in Nigeria here, in the boarding house, we need to ask questions. You know, really ask questions. How are you doing? They just tell you, okay, they are fine, and then you move on. Ask them, are you coping adequately? What is your best meal? What's your best drink? You know, ask the questions. And then I put something very important here, modeling. With my practice, a lot of parents who take substances, their children also end up taking. I've seen a lot of children who tell me, oh, I saw my dad entertaining his guests. And after they all left, what was left on the table, I tried it and boom, that was the onset for me. A good number of them started that way. And then in the area of treatment, family members needs to support. Like, okay, in Nigeria now, we're having holidays. A lot of people who are in the rehabilitation center will go home to their parents. And I tell people, when these drinks are still available, you have a corner in the home where they're just available. Then you see, relapse is very difficult to maintain. I mean, you see a lot of them who will come back to the drug world after this holiday, trust me. You host heavy parties, you make the drinks available for everyone. That's why parents and family members must support people that are being treated. All of us must continue to psycho-educate people. And you know, this thing, treatment of patients is a multidisciplinary effort. Oh my goodness. You know, we have the social workers. Before a patient can be asked to go home, you know, somebody who has done 3 months in a rehabilitation center, you will call the family members, you will talk to them. What is available in home? Can you clear the house? You know, is there a party? If there's a party, we don't let them go home. It must be after the party so that the person can, as these things can work, because relapse rate is really high. And so everyone must be involved. When I becomes we, illness becomes wellness. Then under the, what can the church do? You know, I'm glad that my father in the Lord is here. You know, there's a lot in someone who is passionate about young people. There's a lot that we're doing at our level. In fact, I pastor in Oshodi. You know, if you know the Oshodi area of Lagos, that's where, you know, I have about 800 young people under my supervision at that level. Yes, Oshodi, where you can easily find it. Even as a pastor, they can tell you, Daddy, what do you, I mean, which one do you care for? And so if you don't know what to do, I've been a lot of young people who need, you know, modeling. You tell them there's more to life. And so we continue to speak. Religious leaders with integrity must speak out and do more. Awareness, welfare. It's not even wrong if we have care homes, ones that are professionally run. You know, strong religious faith will reduce the risk of abuse. And I tell people, you know, do not be misled. Bad company corrupts good character. We need to entrench morality as a church, even as, you know, whichever other in the mosque, it must be spoken about. You know, spirituality and transcendence. I was talking to a young man, I said, you know, you can go beyond this level. You have just one brain. I am going to live for about 80 years. So if you damage it right now, how do you get to continue? Even if we're going to do a surgery, remove part of the brain, you know, it's just not the same. So there's a thin line between normality and abnormality, and nobody wants to cross it. There are a lot of religious bodies who are supporting care homes in order to augment rehabilitation. Some people even make their houses available and things like that. But there is more that we can do. And then government, hey, Nigerian government, many times I don't like to talk about government and things like that, but let's go to the society. We need to educate and frown at self-destructive behavior. Government policies must discourage misuse. You know, if you want to know, there's a cartel, a huge cartel. This thing is a multi-billion-dollar business for some people. So, and that's why we need to engage. There are people who tell me, you know what, I'm not going to stop doing this. No amount of talk you say that will make me stop. So we need to engage those people. I mean, what else can they do? Can they focus on other areas of life? Then community policing. Somebody mentioned the ones that are in sachet, that are sold all over the place. We need community policing in Nigeria. We should know who is living on this street, what's this person peddling, how is he affecting us? Then the school curriculum I've mentioned, from primary, secondary to tertiary, it must accommodate drug education. There are some tertiary institutions in Nigeria where test has been done. They just pick students randomly and they test them. After testing, what happens? Some of these students are being rusticated. After rustication, they are at home, they are lonely, they come down with depression and all manners of things. It will still come back to us professionals. And so if we teach it and we make them understand the impact it will have on their health, there will be a lot of wins in that area. The Residents Association, I've talked about it in our Residents Association. When we meet, it's not just about contributing money for security, like I've mentioned. Before somebody can point a gun at you or knock on your door like they do in Lagos, give us money, they are already under influence. So we need to create more awareness. And the level of poverty in the country is also very high. Sometimes I pray that God will help us in our country. And then to the pharmacists and store owners, if you can hear me, you know, people come in, they buy all manners of things because some people want to sell. They sell to people who are even underage. There are some questions we need to ask. You know, somebody comes to you, they keep buying sleeping pills, all that. You need to ask questions. You need to ask questions. Somebody has a loads of ivermectin. What are they doing with it? Said I could just pop it and what are they doing? We need to ask questions. We need to move away from just making money and touching and helping, because we are the custodians of these medications. And then the fact, you know, the hospitals, our Dr. Adeola has been able to talk about detoxification. Yeah, detoxification will continue at the hospital level, and also psychotherapy, talk therapy, and CBT. Because the talk therapy will not do it alone, it's a combination. And then you have the occupational therapists as well, because most of them that are admitted in the world where I've worked, they're usually mostly university students. And sometimes you see some, they even go beyond 3 months in that place. they are being trained some skills, even if they cannot go back to schools, so that they are able to do something on their own. Things like barbing, artwork, drawing, and there are so many organizations that do all these partnering and all. Then the security agencies, we need to mop up there are loose medicines all over the place, unaccounted for, that need to be mopped up. You know, NAFDAC, you know, NDLEA rather tends to be doing a lot. But like I told you, our population in Nigeria, we should even be thinking about population control now as I speak. I'm sure we are probably close to 300 million. And I'm glad that we're doing this. There should be a lot of organizations that should be doing all of this at the same time, so that we can reach out to more traditional rulers, people that people listen to need to do a lot as well. Where can we get help in Nigeria? I've been talking about Yaba Psychiatric Hospital, and I've always mentioned it because that's where I was trained. There's a drug ward. In fact, we have 2 drug wards, about 80 beds, which is not even enough. We usually have people sleep over to other wards. Yeah, we have geriatrics. Sometimes when we have extended beyond even that drug ward, we have to admit people at other wards, because there usually is, I can tell you for free. Now, even if you call now, they may not get a space for you, but there's an holding area. As long as the space is available, you will be assisted. And there are private organizations that also partner with Yaba. So if spaces are not available there, you can also be referred. In the 6 geopolitical zones of Nigeria, we have 8 federal neuropsychiatric hospitals. Southwest, we have 2. South, there's one in Benin and Calabar. We have Lagos and Abeokuta in Southwest. In Maiduguri, Northeast, there's one. Northwest, we have in Sokoto. We have in Kaduna. And then people there's something about stigmatization. People see you oh, they ask you, what are you doing in a mental home? You know, that feeling, that myth of, oh, you shouldn't go there. I mean, people should not see you there. It is your life. You need to own it. If you are well, people will be happy for you. But if you are down, you know, it becomes a problem. Getting help, to everyone that is listening to me, let me just tell you, getting help is not a weakness. All of us that are here this evening, we are a combination of strengths and weaknesses. When you get help, your weaknesses will turn to strengths. Your challenges will turn to opportunities. So I see a lot of people coming in and they really get well. There are private organizations in Nigeria that are doing fantastically well. Lekki, we have Tranquil and Quest, one of the best of them. We have Synapses services. There are so many of them that are available. But you can always make a call, so that you can be sure that you are talking to professionals who know what they are doing. And there are a lot of quackery going on as well. And that's why it's good to inform people properly, so that you don't get into the hands of people who will mess up your brain. Don't just go to prayer houses. We have somebody who is dealing with medical, they will ask you to fast for 30 days without eating anything. It's not going to help anyone. But so for somebody who is being treated, you need not fast. You have to eat very well. Take a lot of fruit and vegetable and the mixture of food which is being given. So there are, for other organizations, we have Christ Against Drug Abuse Ministry, CADAM, owned by Redeem Inepe. That one well subsidized, you know, which people can actually approach. Then there's also Freedom Foundation, Pastor Tony Rappel. I was going to play a video earlier, but I don't know if we have, you know, just to encourage people on what rehabilitation can do. I don't know if I have time. Maybe I should just keep it. Flora, do I have time?
No, we don't have time.
Yes, we don't have time. Let me just keep that. And so, in order to conclude, I just want to do a conclusion to my talk. Our lives begin to end the day we become silent about the things that matter. The matter of the heart, the matter of the brain matters a lot. We have over 100 billion cells in this brain. Good for communication, and it connects every part of the body. So whatever stops, before you goggle anything down your throat, think, and think. Thank you very much, and God bless you.
Awesome, another awesome presentation and a lot of things to think about. Thank you so much. If you want to stop sharing now, please. Are there any questions or comments anyone wants to make? Before you can unmute yourself. I've allowed everyone to unmute themselves. Any questions? There's a question from YouTube. Some of these issues need for parents to be included. How can they be encouraged? This is from Benevolent on YouTube. How can parents be encouraged to participate? You can take that, Olabode, or
They want me to speak on that?
Yeah, you can go.
There was something I put on my slide, intentional parenting. Like I encourage people. If you are not ready to have children, there's no point. The days of sentiments are over. If I see people now married, I don't ask them, why don't you have children? I don't. I've stopped asking that. Because some people may just not be ready. So if you are not ready, there's no point. But if you have children, you must be able to monitor them. And that's why I encourage people, don't have them in large numbers. And then you should be involved in the life of your children. Both husband and wife cannot do 9 to 5. One of you has got to take something flexible so that you really can monitor your work. It's not going to take forever. 10, 15, 20 years, they're out of the house. But what you do between the ages of 0 and 5, and then I want you to pay attention to some developmental ages, for your children. A child is leaving secondary school to GSS 1, pay attention. GSS 3, pay the necessary attention. They are moving to the uni, pay necessary. I've seen a lot of parents who give a lot. They get off work in order to support their children. Remember, the money that you are spending, money alone will not do it. Engage your children, speak to them. And when they are telling you things, you don't have to scream like, oh, wow, why are you doing this? And I see a lot of our parents talk to me, oh, I don't know when my son started this, I can't handle it anymore. They don't listen to, how can your own children not listen to you? It is possible that at the time they are trying to talk, you were just never there for them. If you don't teach your children your values, the television will teach them what they are not supposed to do. So to every parent that is out there, think about it before you start having children. You can enjoy your life with your husband. After all, the most important thing about marriage is even companionship anyways. So before you start bringing those children, plan and plan very well. So I encourage a lot of people to join, and they are here. And even the person that is asking the question, whenever opportunities like this are available, encourage people to join. I'm sure there's a lot of information. Oh, I'm so blessed. A lot of information that I've heard here today that I've never heard before, even in my years of doing this. And so everyone, our hands must be on deck in order to curb this menace. Thank you very much, everyone, for joining. I know you are going to go out motivated and you will do something, because we are all talking about COVID. This particular one is a huge and is a big one. Thank you.
Thank you so much. We have a few questions for you here. Excellent presentation from Temitope. Marilyn said, fantastic presentation. Very realistic solution, she said. And Mr. Akim said, the government needs to do much more with population of 200 million and still counting. The support is inadequate, and no matter the policies put in place, there's so much that ought to go into implementation. Good enough, this is a medium towards creating more awareness. Well done to the facilitator. Another question from Infinix Note says, awesome presentation. Grateful to the convener and all the presenters. God bless you all. And we have, and that's it. Yes, anybody else has any question?
Can I have a question, please?
Yes,
Can I pose a question? Ola, one of the questions that was thrown to me, which I think will actually be more suitable for you to answer, was how do we, somebody who's addictive, how do we, should I say, convince them that they're addicted? And I said, it's about acceptance. But what else would you do? Because we're working together on this. My opinion is it's acceptance for them to go to, okay, I'm an addict. How can I help themselves? Because many of them are in denial. And not just that as well, between you and me, our culture, which I was very happy about you mentioned, people start getting all spiritual about it. It's a devil. It's a devil. It's a spirit. It's a spirit of this, and somebody's done this and went and ate something. When really, in reality, the person took coke, So how can you convince somebody that they're addictive? Please, I don't know if the lady's still on there, but it'd be great if you could answer that, please. Ola.
Stressed out. That question was for you.
For you.
Yes, it was for you.
Okay, it was for me. Okay, how you convince someone that they are addicted? You know, the journey of a conviction is actually a long one. And unfortunately, if somebody is not convinced, if they don't have an insight into the problem, it will be very difficult to assist them. I don't know if you understand what I'm saying now. Because before you can help, you must come with insight. So what we do, I see some of the patients coming and they're like, well, I don't know what I'm doing here. My parents have money to spend, and that's why they brought me here. I'm like, this person doesn't have insight. What we do, we go back to medication, which is very important. And then we cannot also completely rule out spirituality. If you ask me to do psychotherapy for someone now who doesn't have insight, it will be very difficult. So I refer them to a psychiatrist who will actually do the medication aspect until they are convinced. And I see a good number of them coming back and say, oh, I think I understand what you were doing with me now. Until they are convinced, you cannot help. But for those kind of people, you have to continue to talk. And if you are talking and it's not working, they will need medication. All the things that Dr. Adeola has said, they are very much on point. I'll ask us to go over this video. Even after now, we should go over and over again. It's enough for a lifetime. So we can also pray. You know, I mentioned fasting earlier. If it's possible, you do the fasting and prayer for the patient. But when somebody is on the ward, don't tell them to go and fast. Because the medications will need food to work on. Otherwise, they're going to lose a lot of, if you see them, I mean, you will not recognize them the next day. They need to eat and eat well. Come to Yaba, those guys, they eat. And these are very intelligent young people. I love to go there. If you haven't been there, you will see students from the best universities, you know, both public and private in Nigeria. Very intelligent people. When we do our group counseling, they will even be the one to talk about the medications. They know, you know, that by the time they are taught, they will know the symptoms, they will know the effects. They preach to you. Some of them even become born again and even pastors right on the word. But sometimes when they go out, if they don't have anything doing, people have to be engaged. We need our population. We have a lot of people who are doing nothing. So if you don't, and I do mind this devil's workshop. So if anybody isn't doing anything, the easiest thing they can do is drugs. They're available everywhere. So a lot of Nigerians need to be engaged, and our government needs to do a lot on this area. Private organizations are trying, but the government has work to do. Thank you. I hope I've been able to answer that.
Yeah, that's
Yes,
answered the question.
Yes, I have something to say, maybe please, about that, because to how you can convince them they are addicted. In a lot of cases, they don't want to be convinced that they are addicted. There is stigma to addiction and mental illness. So there is that stigma. Then they don't want to look like, oh, I'm not an addict. I just use this cocaine every now and then. So they try to give excuses. So we have to let them know the negative effect this drug is having on them, both physically and psychologically. You know, like some of them, they lost their home, the wife took the children and left. So it's all kinds of stuff and they cannot function. So we have to go over that with them. Like, since you started using these drugs, you've experienced XYZ and all kinds of misfortune in your life. You are miserable. You don't feel good when the drug is out of your system. You only feel good when the drug, you know, is in your system. So we have to convince them with that. Remind them of the negative effect that drug is having on them. And then in terms of treatment, I think the government needs to get really involved, because in the US, the government already set up different methadone clinic. And then in the VA, in different hospitals, you know, you can just go there and register and be treated, you know. So our government needs to do better. They need to set up drug addiction inpatient setting and drug addiction in the outpatient setting. They need to set it up. And because I know the buprenorphine is very expensive, but it's a very, very good medication that when people know already accepted they are addicted, willing to take it and have the means to take it, when they take it, they're able to stay away from opioids for the longest time. They maintain abstinence and cocaine or any other drug. So it's just that the Nigerian system, government, they need to, I don't know how we can convince them. I don't know whether the physicians over there can come together and go to the government. They are the one with the money. Please release some money for us. We want to set up addiction clinic so that people can come and get help.
Thank you. Thank you. We have Dr. Bafemi's hands raised. Go ahead, Dr. Bafemi, please. You can unmute yourself.
It's not. Okay. I've heard people say we need government help, we need government help. The challenge in terms of Nigerian setting is this. The government is not going to do it. If you are waiting for the government to do anything in Nigeria or in any of these African countries, you are going to wait for a very long, long time. And so really the only way we can really approach this is the societal level. Because the thing is this, the people who are making money out of this drug addiction and things like that are the people that are individuals, people around in the society. And so at the end of the day, it's about having to be able to be our brother's keepers. And that is the thing that will be a major factor, really. It's something that we could be at, because if you look at it, even the health center that will treat malaria and everything is not functioning because the money voted to keep it running has been squandered. Someone has stolen the money that was allocated for that. So you will be hard pressed to see any government saying we are going to allocate money for drug addiction, because the first thing they will say is self-affliction. I want to treat people with the malaria, hepatitis and stuff like that. And so they will play to the emotions of the populace. But it's the populace themselves that has to come together and say, look, this will not happen on my watch. And honestly, and also my second comment is this, is that in terms of the addiction situation, until the addict recognize there's a problem, until they hit the rock bottom, honestly, you're wasting your time. Although you can support them for them to acknowledge them, until they acknowledge, until that person acknowledge I'm an addict, because that's the first step on the way to recovery. Until that person admits I'm an addict, and then make a step. And also, even when they have been clean of the drug, to always know they will always be an addict, so that they don't make the mistake of saying, oh, well, I'm over it, I'll just try it again. Because once you try again, the receptors will be alive again to the addiction again. And so that is the thing, is the contingency plan to know that this has to happen. But if we are waiting for government, because see, every law that we have said about this law, there are thousands of laws in Nigeria. The honest truth, they are not being, it's the enforcement that's the challenge. Even if we want to enforce it, if someone can be bribed, they will look the other way around, or other way, and let you go. So I think it's a societal problem, and that is the main challenge. And it's until the society comes to value or go back to the good old days where it takes a village to look after it, to train a child, we'll be chasing shadows. Thank you.
Thank you so much for that comment. A lot of 100% truth there. We have Sebastian. Go ahead. You can unmute yourself.
Good evening, sirs and ma'am. Mine is a contribution as well as a question. First and foremost, I'd like to thank all the presenters. I think I've gained a lot. Okay, just a bit of my background. I have a background in drug law enforcement in Nigeria. I'm currently based in London, and I've worked in mental health as a care manager, and so I understand some of the issues that have been discussed. Now, okay, without talking too much about myself, I had a lot of comment about what Nigerian government is trying to do about drug addiction in Nigeria. So I just wanted to find out whether most of the participants here today are aware of the fact that we have a drug demand reduction directorate in the National Drug Law Enforcement Agency in Nigeria. And the primary objective of that drug demand reduction directorate, which is all over the states, because we have state commands in the 36 states of the Federation, is actually to deal with rehabilitation. I'm still in touch with some of my colleagues in that organization. I mean, we chat regularly and we discuss. And so I'll be interested to find out whether there is collaborative working with that organization, and if not, why not? Because like I said, I believe we've just spoken about the society getting involved, and if that is a government agency already established, there's no reason why we should not utilize that resource. And if there are gaps, identified by users, then obviously that needs to be put to the Federal Ministry of Justice that set up the National Drug Law Enforcement Agency. Then that's one aspect. Then the second aspect, as far as I'm aware, also, based on my experience of working with the organization and still be part of the organization, because, once you are somebody, if you're a teacher of a school, you're always there, even if you leave. I do understand there are drug-free clubs in universities, in secondary schools, and so on and so forth. Again, are we utilizing those resources in terms of education and awareness? Because that's where it starts from. I've heard a lot of conversation about parents. We know that the world has gone cyber. And so as much as parents are trying to restrict what young people are exposed to, reality is the wider society is exposing them to what we don't want to expose them to. So I'll pause there for a minute. Maybe somebody can give a response to those two key questions. Are we utilizing the drug demand reduction, Directorate of the National Drug Law Enforcement Agency? If not, why not? And then also, secondly, the resources available in our educational institutions, such as university, colleges, secondary schools, and so on and so forth. I'll pause there. Thank you.
Before anyone says anything, did we even know that that command existed? Okay, over to everyone else. Olabode or Dr. Diola, whoever wants to comment before I go to the raised hand.
Ola, you're based in Nigeria, so
Olabode, did you know about that command?
Yeah.
Wow, I'm hearing it for the first time. Just like a lot of other government organizations, even the Nigerian Orientation Agency, you don't get to see much of what is going on there. But it's good, as we know now, we'll look them up and we'll see what we can do with them. I was even going to ask if the man on the street is aware of these people and how much are they doing.
Okay, can I respond briefly to that?
Reduction Directorate is a lane to me, so.
Yeah, respond. And can you put the actual name in the chat for us as well? Go ahead, you can respond.
Okay,
yes. I'm interested in that.
Okay, I think, let me put on my video so you can see my face.
Yes,
okay. Like I was saying, is the National Drug Law Enforcement Agency in Nigeria. I think we are more recognized for carrying about guns and arresting drug barons and dealers. So you wouldn't know a lot about the Drug Demand Reduction Directorate. That's why I asked the question. Like I said, our head office is now in Abuja. Previously, we were at number 2 Rustin Road, Ikoyi, Lagos, and number 4 Shore Road, Ikoyi, Lagos. Both addresses are very close to each other, and they're still there. The offices, Lagos State offices are there. Then, like I said, there are state command. Like, for instance, in Lagos, the Lagos State Command is based in Nako, close to the airport. And so in various states, you will find state commanders. So once you just ask anybody, any security agency, National Drug Law Enforcement Agency officers, they will link you up anywhere in the Federation. Like I said, we have area commands that goes down to the roots of, for instance, or to local government wards levels. So if we have people who have these substance misuse issues, they really need to be seeking help from the government through that resource. Because I was looking at some of the slides that are being presented, and someone did mention that, for rehabilitation, you go to some of the centers and they charge you 250,000 naira, to start with. How many people in Nigeria can afford that? We're talking of a country where minimum wage is 30,000 naira now. Let's be realistic. And with the level of corruption as well. So my suggestion is, moving from here, those of us who are based in Nigeria, please, again, it's very popular. Nobody who doesn't know General Buba Marwa, He's the current chairman, chief executive of the agency. So if you Google General Buba Marwa, everything about the National Drug Law Enforcement Agency should come up, and all the state commands, zonal commands, everybody, so they can start reaching out. And like I said, I'm interested myself. If they are not doing well, I'm a critic of the Federal Ministry of Justice. So I will get in touch with the directors of the agency and find out, where there are pressures or gaps and why they are not doing what they ought to do. So thank you very much.
Thank you for that. Thank you. So Dr. Bafemi?
Well, okay, yes. As much as I like that this organization is there, if the people who are really the NGOs and the people who are working in the system are not aware of them, then it begs the question whether they are effective. That's number one. Number two, sometimes when you engage these people, they are not financially resourced because the focus within the department is different. There's a different kind of I would like to know when these people, the NGOs or people who are working within the system, approach this branch of the government, what they will meet there. Because I have had to do, not definitely with the drug enforcement, but with other services. And believe me, even when you are going there to help to say, I just need registration, you'll be astonished what they will be demanding from you, or they will be giving you a run around that your head will be spinning. Things that should be made easy, they will make it so difficult that you're almost giving up about doing anything. So that's my own challenge. So, but I might be wrong. So maybe the people who are within the field will put it to test and see how much this government agency will be helpful, and let's see what happens. Thank you.
Absolutely. And if anybody does try to contact those agencies, if Sebastian can put his details in the chat, he's interested in finding out whether anything happens or not. So Sebastian, if you can put your details in the chat, and then there's some sort of follow-up there. Oluwatoyin, go ahead. Oluwatoyin, you had your hand up.
Can you hear me now?
Yes.
Yes. In fact, I am happy with what Sebastian just said. There is UNODC in Nigeria, and they are doing a lot in terms of drug reduction for like support going out to do enforcement on those.
Sorry, what is UNODC? What is UNODC?
United Nations of Drug Demand Reduction.
Okay.
It's on drug demand reduction. Yeah, that is UN. United Nations on Office on Drug Reduction. That is UNODC. Drug and crime. Sorry. United Nations Office of Drug and Crime. UNODC. Yes. That is the UNODC. They are doing a lot in terms of collecting drugs from the dealers, but they are not doing enough in prevention programs. They are not doing enough in rehabilitation of these youths. I'm happy Sebastian is there. I believe he can hear me. I could recollect 2004, 2006, when the UNODC are still in Lagos State, where he just mentioned the offices. They are working with NGO, with the grassroots organizations before they moved to Abuja. But immediately they moved to Abuja, this their work, their strategy reduces more and more. So to the extent that they're now working at the high level, they are not working precisely with the NGO in local governments again. If they said they are doing that, that's a lie. Most of the work that they are doing now is on research, and they work with let me say governments now. But if you want to work on this drug, because I could recollect they did a lot of work 2004, 2006. I even want to part of the NGO that they work with in Lagos State. We have NGO network of, and then the network of drug reduction, and then then I could recall, but now I did not even hear of that network again. We don't know what is going on again in drug demand reduction. That time we go down, we create awareness in schools, we go down in the community, we work with the community leaders, and we work even with these youths at the community level. I said I work at Peti, I mentioned Peti. That is where, and Agarawu. This is where in Lagos Island, where these boys are really, really down the strum on this drug intake. So I will appreciate this group now that we are working, that we are talking here now, because that's why I go down to the end of this meeting. If Sebastian can talk to the government on, you know this thing now on coming to the community, coming to work with the grassroots NGOs. I believe we know our community and we know these boys, we know their parents. We can walk down the grassroots. And this, I believe they can, well, I don't know. I don't want to talk about the financing now, but they need to finance. They need to finance this work. If they finance it, the NND.
Oh, I think her network has
DR
gone.
will come back. That is the network effective. Thank you.
Thank you, Toy. Please drop your details in the chat as well, in case anyone wants to contact you and the name of your organization. We have a question in the chat from Ayobami. What of addiction to pentazocine as a painkiller? Can the altered pain threshold be restored to normal again? Who wants to take that? Anybody can take that. You can just unmute yourself, one of the speakers. Addiction to pentazocine as a painkiller, can the altered pain threshold be restored to normal again? You're off mute, Marilyn.
Thank you so much. It depends on how long it's been taken for, because what happens is if you stop taking it for a period of time, your dopamine receptor, the particular receptors then become normal, but it takes a while. So it does depend on how long you've been taking it, the doses you've been taking, and I think it depends on a lot of time. So if you've only been taking it for a short while and you've become a little bit addicted to it, if you stop, I'm sure the receptors can regain their sensitivity again, but I'm not sure if it's going to be 100%. Yeah? There.
Okay.
You there?
Okay, yeah. Tony, is that okay? No, sorry, Ayobami, I think he did not mute himself, but that was a question in the chat. I don't know if anyone wants to add to that.
Sorry, I also wanted to say, because it works, it works on the mu, kappa, and delta receptors. Those are the receptors that opioids work on. Yeah, so it does depend on how long and the frequency. Sorry, just wanted to specify the receptors as well.
Thank you, Marilyn. Anyone else want to add that? Dr. Adiola, do you want to say anything about pentazocine? Okay, maybe she's stepped away. All right, Sebastian, I think wants to come back. Go on, Sebastian.
Yeah, just a brief comment. Now, I've got what the roles and responsibility of the Drug Demand Reduction Directory of the NDLA is. I've also supplied the link, the website of the organization. So everything you need to know about the National Drug Law Enforcement Agency is there in the link. Anyone can log on now, or rather, you can see it right now and share information. But the directorate I was referring to is the Drug Demand Reduction Directorate, which is, you will see, is all listed there, what they are supposed to be doing. So it's here about educating the populace, and then through TV shows and all that. And I know our colleagues are doing it. So that's why I'm surprised, actually, that none of the participants here today know about us and that drug awareness, effort of the federal government. I mean, there are a lot of things going wrong in Nigeria, but I do give kudos to my colleagues who work in this directorate, because they are far-reaching. Even some of them who have left the service, they are setting up their own rehabilitation centers across Nigeria. So if people do link up with this, directorate within the NDLA, not NDLA as a whole, because like I said, that we have the various directorate, but this specific directorate, Drug Demand Reduction Directorate, then there will be a lot of collaborative work. We work with NGOs and international organizations. Thank you.
Thank you, Sebastian. Any more questions or comments? While we're doing that, I'm just going
to make a comment. Sorry.
Yeah, just give me 1 second.
Of course, Flora.
I just want to say thank you to everyone before we finish. Thank you to our sponsors, Victory Drugs and Vision Resource, and my many supporters and my many helpers in the background. Some of them were not able to join tonight. And of course, thank you so much to the speakers tonight. Thank you so much. I do appreciate it. And I appreciate everyone who's hung on so long. It's been a long one. But as usual, I don't like cutting it off because I know people want the information, and that's the whole point of the program. I just wanted to say a quick thank you to the sponsors, Mrs. Lawal of Victory Drugs and Shaki or Vision Resources. And yeah, all right, Marilyn, go ahead.
Sorry, it was just to say what we do in the UK is peer support. And the gentleman Belogan, Mr. Belogan, the gentleman with the young kids who went to where they started off from, what we need to do is it's peer to peer. So if those same kids can go back and send a message out that, listen, you can get better. So what they're doing is a great start. It's better. Little drops of the ocean, you know, make a mighty, little drops of water make a mighty ocean. So at least let's not stop that work. At least that work has been done. So when the peers go out there and say, listen, we can change, you can change, your life can get better. Then the other person says, can they take me too? Just like Mr. Belogan is doing. So that's the first place we can do, because it would be horrible to leave this presentation and think, oh, it's a shame. The Nigerian government isn't doing anything. Let us actually try and do something, because at least we're doing something. We're being proactive. This has been an effective, you know, should I say talk or seminar, because we're going out there and we're being proactive and we're making a change. So I believe each one of us can make that necessary change. And it starts with either you or me, not people back there in Nigeria, but you or me. If it's to send money to this gentleman, do whatever you can. But those children are our future. Thank you. Sorry, Flora. I'll keep
it's all right.
now. Flora knows me from uni. I can talk for England.
Thank you, Marilyn. Any other comments? Just raise your hand or just unmute yourself and speak. It's been a long one. I can't believe we've gone this long. Well, actually, I can. I was expecting it that that would happen. Tony says, yes, peer support can also help through the grassroots. I think also, again, education starting from primary school, not even secondary school, from primary school, awareness. There's a lot of public health awareness that needs to go on in Nigeria, and that's why this program was established. But there's a lot of public health awareness that needs to happen right from primary school, from the grassroots and up. We can see how many people are on here today. I dare say if it was something else to do with finances, we probably have more than 100 people. But anyway, thank you, everyone. Is there any other comments or any other questions before we say bye-bye? And I say thank you once again. Please, my speakers, don't go yet. All righty, so it's a wrap then. But before you go, don't go yet. I just want to stop streaming.